Namaskar. Welcome to all respected delegates, dignitaries on the dais and off the dais. On behalf of Independent Research Ethics Society, I would like to welcome you all on this knowledge sharing platform and our journey of 317 webinar. The continuous journey, brainstorming journey, knowledge sharing journey, and beneficial for all non-commercial journey is possible only due to your continuous supports, guidance, blessings, and contribution as resource person. So we are grateful to all. Professor Bishnupriya Sharma ji, Professor V.K. Agnihotri ji, Professor Madan Thangavelu ji, Professor Dr. Jagdishwar ji, all have blessed us every time, and we are grateful to them. Today's speaker, Dr. Bishnupriya Mohanty ji, Professor and Head of the Department, Gomantak Ayurvedic College and Research Center, SHIRODA, Goa. Second, Dr. Baljot Kaur. I will introduce at her time. So before wasting much time, I would like to welcome Dr. Professor Bishnupriya Mohanty ji, Professor and Head, Gomantak Ayurvedic College and Research Center, Goa. Welcome. Today we are celebrating some Women Liberation Day in Russia at that time, but we have connected our Ayurveda for infertility, which is a burning problem in this era. Welcome, Dr. Bishnupriya ji. Welcome. आपकी आवाज नहीं आ रही है, म्यूट है.
Yes, and now my sound is audible.
Audible. Definitely audible.
Slides are moving, sir.
Yes. Welcome, Madan sir. Welcome. Welcome, Bishnupriya Sharma ji. जी, डॉक्टर विष्णुप्रिया जी, आपकी आवाज आ रही है विष्णुप्रिया?
Yeah, namaste to all the authority and dignitaries from the organizer side and my co-speakers, and all the global citizens who are listening to me. So today we are celebrating this with a special gratifications to the disease infertility. So this disease is very well known by its term, and it is not a problem of these days. It was in our ancient days too, and we can get a huge amount of literatures about the causes and eradications. And eradications from different aspects, by correcting the physical body, by correcting the psychology, by correcting not only the deeds of this life, how we can correct the deeds of previous life. Those all aspects has discussed. And with a very minute things has tried to incorporate and to treat the problem of peoples. Because this is the real, that is the real essence of each and every profession, and how we can solve the issue or problem of the peoples and the society. So that way, if we go through the Ayurvedic classics, we can get huge amount of references and the mechanisms how we can understand and eradicate this disease. And by that term, this disease has introduced that it's a biological inability of a woman in her reproductive age to contribute to the conception, and also the state of woman who is unable to carry a pregnancy with a full-term baby. And the time limitation has given that with unprotected sexual intercourse up to 1 year or more than that, if she is not conceiving, that's declared as a disease conditions or the lady branded with a term. Why I'm speaking branded, some slide I kept at last. And we can see the terms here that focus is given into the woman itself. And therefore, we are creating so many social imbalance. And that's a drawback of these definitions. And now proceeding to the statistical highlights, we can see that infertility may be due to the male factors, 30 to 40%, and female factors about 40 to 55%. It means both the partner very less margin. They are different, but still all the claim go to the woman itself. Therefore, it is linked with the woman mass. And rest of the 10% cause is unknown. So we are idiot enough. We are unable to explain the cause of infertility. So we are not agree that we are idiot, but we are speaking it as an idiopathic disease. And the cause are with a long range, like ovarian factors, the age-related factors, uterine problems, the PCOS or the different variety of endometriosis, and the ovulation disorders maximum times comes to us with a PCOD cases associated with infertility. And the causes are hugely available, like that there can be some hormonal problems, there can be the link with the organic deformity to the ovary and uterus, and sometimes everything is fine, but it's like by putting a long line on the forehead, doctors speak that you both partners are correct through all the investigations, but still we unable to give that opportunity of getting child. So just leave all the work, go somewhere, you will be relaxed, then you will have a child. This is a reference, Charak Samhita Sutra Sthana 25th chapter. So Agre Sangrahana has enlisted. So it is a mental happiness can give, might be the cause what has kept under the 10%. And how we get the clinical confirmations. So that clinical confirmations can give, when a little bit references will go through the Ayurvedic classics, we can see that many list of Univyapad has counted under the cases of infertility. We can see the abnormality to Artava Srotas. Sometimes the Nastartava can be, sometimes the Khina Artava can be. There's a huge list of these, like say Puspagni Univyapad, the Jatar Univyapad. So these all list indicates that it's not a simple issue. It's a issue coming from a long time and still persisting and still become a challenge to us. And the classical informations, if we'll segregate, then we can get a lot of regions are related to the Vata dosha. And because of the malnourishment, in the sense we should interpret in two ways. Mal it is less, mal it is wrong. Though both the way, M-A-L, M-A-double-L, both the way if you think, then only the answer can get out. Rather, we may get confused that how we can say that every time Vata is a cause of that one that two. And that how it can lead to the Bijopaghata or Puspopaghata. So that's the way we have to interpret. It is Bata in the tense of in the sentence of the Kshaya, Bata in the sentence of Margabra. So both the way that possibility can be. So to make more easy, I plan today that why not I will take a case so that it will be a way of concentrating minute things behind a clinical sufferings. So I kept this case, that is a case of 23 years age, coming to the OPD with a scanty menses. It means some simple complaint of scanty menses. That's a sign of infertility. So it is exaggerating the concept of Rajaswa Paricharya by putting these pictures, cinema, fed men, etc. It is just passing the message to the young girls that MC is like so difficult problem, difficult task to us. It is better that should not be, or very minimum with a minimum days it should stop. It's like a problem to the ladies. That continuous practice of such things, such mentality, actually leading to the scanty secretions, and those scanty secretions today can be a cause of infertility in futures, and the whole family life and the will be disturbed, and each and every family member suffer those problems generation by generations. Because once the brand will come to one ladies, then the future generations will also branded with the same things. So she married before 4 years, and her history was like that she get menstruated with a 40 to 45 days, with a duration of 1 to 2 days, with the inability to conceive since 3 years after having unprotected sexual relationship with her husband. And going through the sonography report, we can see here the uterus size is almost all normal. The ovary, ovarian size, shape, and the echo textures, etc., are also good. But there are multiple numbers of follicles in the peripheral, with a peripheral distributions in the ovary, maximum size up to 6 mm. And the right ovary volume is 5 to 9 cc, and the left ovary volume. So these are the mechanical or the organic deformity takes place to the site of ovulations. And when we go to inquire about the husband's conditions, no such significant changes there. It's quite normal. And every wrong things here, say HIV or VDR, etc., is normal, negative. And then we go to inquire or review the case. What are the different other history? So by reviewing the patient previous history about the medication and all, the menstrual history started with the menarche as 13 years, duration of 1 to 2 days. It means starting from the menarche, it's showing it's not good. And with the interval of 40 to 45 days, the present problem is like so. It is again scanty, and with associated problems of pain, smell, and clottings are there. There was no history of contraceptive pills, and there is no such significant history of such biochemical parameters or we can create a metabolic deformity that were also absent. And obstetric history, that's well known to us. And proceeding towards the physical examinations, it is again, we can see the height, etc. Everything is quite fine, quite normal to conceive a baby. And as a routine protocol of our hospital itself is NABH accredited hospitals. Going through the hospital itself is a routine protocols. So these all things we take regularly, and we can see these all are again looks like Madhyama Sarva Margeshu. So this is not a so critical points to think about. The persons can have a disease. And next, we plan about the treatment for that case. So treatment was both oral and means Samana Chikisa and Sodhana Chikisa. So we planned about a Basti Chikisa for a course of 3 months. That is after the MC, we started the Basti with the alternative applications of Dharantal and Polaskadi Patha with a alternate application on Nuvasana and Asthapana Basti. So that can be seen here how the planning was. And next to it, the procedure of Basti, it's a very in general before we go for the Purva Karma, and then video on so the Purva Karma, it is routinely like Sarvanga Snehana Swedana, then the Pradhana Karma, a routine application of Basti. That's the procedure well known to everybody else. And next, the Basti Drabya is necessary to get. That is again the we can see in next chart here. And we have instructed the patient, not so very specific about the diet and all. It should be easily digestible, looking to the Agni, Kosta, and Srotas, etc. And the Samana Chikisa orally it has given, so we can see that there was already Khirapaka And Stree Vyadihara Rasa, that's a compound formulations of all these ingredients like Sutika Purana Rasa, Lata Karanja Bija, and Satava Bija. So these all mixed with an Karpa Singular, etc. So with Kumari Asava 20 ml with an equal amount of Dasamularista. So the mode of actions and why we are planning, because our watching was on the total corrections of the systems, that how the ovulation could be good, how the endometrial thickness could be corrected, and most of that, initially our target was to regularize the menstrual cycles for the nutrition purpose of the ovulation, size of the ovum and all, or the nutrition of the endometrium itself. And we have given Kumarasava because we're watching that the scanty menstruations and all these issues are related to the PCOS variety of things. So with that, predictions of the treatment, we have proceeded to check in between the treatment. We started to check through the sonography, and after 3 months of treatment, the menstrual history was taken. It started with 45 days, and the interval is a little bit corrected, or what is expected, it works accordingly. And the associated symptoms like pain, smell, clots during the menstruations are not present. Patient was advised in the following cycles for Graphian follicular study, along with the Ayurvedic medications for ovulation inductions and proper development of the endometriums. So during that, going through the report, the thickness on 11th day it was 6 mm, on 14th day it was 8 mm, 16th day it was 12 mm, and when checking about the size of ovum, it was 16 into 16 on 11th day. Then on the 16th day, 14th day, it was 16 into 17, and again it is improved in the 16th day to 23 into 17 mm. And next, we are proceeding to continue or to little bit revise to the treatment, thinking that everything is going correct. So there will be good conceptions and the offspring will be again healthy. So thinking such, we are proceeding to introduce Nagakesara Churna with the Tripata Churna, and with this dose and the frequency. And next, this is a combinations we routinely use to correct the size and all, or the travels of ovum from the Graphian follicles and the burst of it, and it coming out. This whole process, this whole mechanisms, it will be nourished through these medicines, and that way we proceeded. And as she perceived or for pregnancy, then we continue these medicines, especially for a Jivanya Balya actions expected by us. So the result of treatment is very evident. The patient missed her next period, then after 2.5 months got her UPT done, and which was found positive. The patient was advised for ultrasonography to confirm the pregnancy. After Sadhana Chikitsa, along with the oral Ayurvedic drug, patient got normal menstruations, ovulations occurred, and ultimately result in conceptions. So this is the way or mode of action we can say. This was the sonography report of the patient. And next proceeding, that how these things happens, what was the mode of action of the medicines. It's our predictions that Basti is said to be the best treatment of Vata disorders. And when we introduce the Basti, it has written that immediately it can work or govern all the different biochemical parameters or the transport systems in the body. So if you see the nature of GIT, the end part of GIT is highly decorated with intestinal villi. So instead, by skipping the whole process of digestion and all in the upper part of GIT, Basti is considered as the Chikitsa. But the reason is that the absorptions through the villi, it will become more good, and with a shortest way, it can control all the three dosa. So that's the reasons why we select the Basti itself. and the faster efficacy on the all genitourinary system. And next, if it removes the Vatarodha or the Margaborodha, it regulates the Apana Vayu. So it's the Apana Vayu not at the Apana Khetra only, Apana Vayu at the whole body, because Apana means, grammatically, Apana means Tyaga. So any air going out of the body, the Basti have a control on it. It could be the exhaled air, it could be the Apana, the whole nervous control to the genitourinary systems. So all the way the given Basti works on the menstruations, works on the ovulations, works on the first good proceed of the ovum itself, and the given samana chikitsa, that is Vata Samaka, Vata Nulomaka. So saying Vata Samaka, in the sense, Vata will regulate the control of Pitta and Kapha. It is not only the Pitta and Kapha, the resiliency of Dhatu, it actually receives those informations from the Tridosa too. And Raja Pravartana, that's the nutrition itself responsible for the Raja Pravartana, and all the Balya Rasayana Ausadi work that way. So the construction, the preparations of the cell, the nirmiti of the cells, and its traveling. So Raja, Pravartaka, that is how it is proceeding to the next, how it is traveling. Those all need the corrections about the dosa itself. So that way about the dosa is necessary. And all these Ushna Virya, Drabya has given, like Trikatu, etc. We may have seen that is Pitta Vardhaka, of course, and it is needed for bursting of the cells to accelerate the Gati of Vata dosa. So, and that's the reasons we speak that Basti is Srota Sodhaka. So Srota Sodhaka, Srotas Ayamam Saridam. Each and every cell have an interconnectivity to the other cell with the Srotas itself. And that way, the biochemical parameters changed, the endocrinal control has changed, and nervous control has changed. Therefore, all these good pictures comes to the lady. And next, about the Stree Vyadhihara Rasa, it's a beautiful combinations of Ushna, Sita, both. So sometimes I used to ask, if the patient have a disease because of the Sita Guna, do we feel that by giving Ushna Dravya it will correct it? No, it's sometimes not possible, because the nonlinear systems approaches to the whole environmental factors and behave something differently. So we have to keep a approach of seesaw. All the three dosas should be regularized. So that way, this whole combinations are necessary to med, and that correct the ovarian functions, and the bringing the re-establishment of menstrual cycles in a good way, nourishes the follicles, nourishes the endometriums of the uterus itself. And Berberis aristata, that effective in insulin resistance. So insulin resistance in the sense, when insulin is sufficient, but the insulin receptor cells are less because of the fat cell. So less numbers of insulin receptor cell unable to take the insulin enter into the cell. Therefore, even though insulin is high, still we say it's a hyperinsulinemia. So in that case, it will correct that resistance, and therefore it's the efficacy is like, say, as we see in case of metformin. And Nagakesan or Trikatu are given for ovulations and proper development of endometriums, appeasing that it is also doing the Vata Samana. So Vata is in terms of Chala, Vata in terms of Ruksha, all these way the differentiation in the mode of action will to necessary to understand. And it aggravates or detoxifies the Pitta. So Pitta detoxifications in the Pitta Samana, what it means, it is detoxifying Pitta. What it means, detoxifying in the sense how much heat, how much Ushna, how much Tiksha, how much Dravatva we need. So that is the regularizing Ushna, Tiksha and Dravatva. That regularization is the maintaining the resiliency. So that is needed. And that is corrected by the leptadine or the satabari. That's a good source of we say it's a balya, and even the tiktaras about guru and snigdha. So that's a God, it's the God gifted drug. So we need the tikta, that is Vayu and Akasa. We need the transport systems. Vayu and Akasa is responsible for the transport system, and that transport system nourishes the body, nourishes the follicles by supplying the guru snigdha guna and madhura vipaka and rasayana too. And next, proceeding the Satabari Kalapa in Kashyapa Samhita, it is mentioned that Satabari acts as a vector for women with hypomenorrhea, infertility, women with a history of weakness. Weakness in that sense, that's the status of Sukra Dhatu I like to speak. That is again Sthanika Sukra I will speak. Sarvadahika Sukra, that is related to the Bala, and here the Bala, it is the Sthanika Sukra. That way the interpretation I like to put against these presentations. And Satabari is rich in folic acid as per the language what the contemporary science teaches us. That moment the confirmation of pregnancy, they start the folic acid. And naturally folic acid is present in the Satabari. So it's a critical nutrient required for the development of fetus. It is much essential for the neural development of the fetus itself and important for formation of new cells and DNA in the body. So, and next drug, that is Vitus agnus, its extracts helps to maintain the hormonal levels, that is prolactin, progesterone, and estrogen, thus helpful in the symptoms resembles to the PCOS, which control over all such wrong issues related to the PCOS cells. And the leptadine, that is a combination Jibanti and Cambogic, supports the proper implantations of the fertilized ovumes. And there is a big gap. I knowingly kept this slide. Now the picture has finished. Now, after the finishing of the pictures, what I like to speak, it is not possible to treat each and every patient through this way. Why? The reasons are many. Because the establishment of disease depends upon the Bikara Prakriti, the Adhisthana, the Samuthana Vishesha. These all things are a big chaos, big turbulence. And each and everything to be understood by the patient, not by the physicians. So here I like to address all the peoples here present here to listening to me, that those things is necessary to propagate to the society. So, Srila Prabhupada, the profounder of ISKCON, he went to Puri Jagannath Dham to see or to visit to Lord Jagannath. But there is no such, provisions that the foreigners can visit. The people who went to foreign, they cannot enter into the temple. So Jagannath comes out during Ratha Jatra to visit such all peoples, to irrespective of any race, religions, any country. And that time Srila Prabhupada took a promise. तुम मुझे जगन्नाथ नहीं देखने देगा, तुम्हारा जगन्नाथ को मैं लेके जाऊंगा. So it is Srila Prabhupada established the ISKCON and propagated the concept of Jagannath Sanskriti. And now it's the time how we can propagate Ayurveda, taking from the hospitals to the mass populations. This is my target, why I take all the efforts taken by Pawan Sharma sir. I never disagree with his decisions that how we can work on this. So this is a big issue. It's need to propagate that the infertility to treat only can be treated if we think all the dosa, dhatu, and mala togetherly, when we can able to understand all the chemical and hormonal reactions in terms of Agni, in terms of Koshtha, in terms of Srotas, then only the complete treatment is possible. And it is never happens when the patient is suffering infertility. It should be started during the from the periods of menarche itself. We should have a close watch on all the three dosa, work through the Visargadana and Vikhepa concepts. Each and every person's food, each and every person's lifestyle should be customized. That teaches Purusam Bhiksham Saggayam Bhisakuttamam. This treatment protocol might be sufficient to this lady, and it cannot be followed for the other ladies. So it is the customized treatment of Ayurveda to be propagated from the hospitals to the each and every citizens of the globe. And the complete concepts of dosa dhatumala, vikriti concept, prakriti concept, and the food and lifestyles, the diet patterns, not only the diet, सिर्फ खाने के लिए नहीं सोचने का, हमें कौन खा रहा है. That is much important in the treatment of infertility, because the claim went to the head of women, and one side she is facing all these claim, another side you are expecting something good will happen. That never happens, because we are the non-linear systems. We are more approaches toward the emotions. Whatever the problem happening to the physical body, that picture has written in the emotional structures. So it is the different chemicals we are using in terms of body spray, in terms of lipstick. So all these chemicals again exaggerating our body systems and unable to conceive a good baby, unable to mature a good follicle itself. So these concept of epigenetics, concept of lifestyle, concept of the external and internal environment to be propagated to the common society, and our sleeping patterns, our behaviors, our thinking patterns of the people around to us, how we are behaving them, how they behave to us, all total effect on any disease, and also to the disease of infertility. And the Agni concept, the free radical and antioxidant concept, those all concepts, the Rasayana concept, those all concepts are essentials. And each patient should think like a doctor. So when a patient starts to think like a doctor, he can watch on the biochemical parameters. Each and every response of the body, he can edit, he can understand, and he can easily express to the physicians. So this is essential to make a bridge in between the concepts of Ayurveda, concepts of biochemistry to each and every citizens who are seeking to be healthy, to be happy throughout the life. These are the different treatment protocols need to propagate. And more to that, there are some social issues which are more evident in these days of around 15-20 years. Because every lady start to think, I should be a very big lady, because freedom is equal to the gents and ladies. So whatever the gents are doing, I should also do. So exposing to the alcohol, that's the biggest issue of infertility. Exposing or maintaining the living relationships before the particular age, the quality of Sukra Dhatu, the quality of ovum itself just decline and unable to conceive the child. And there are many social issues, late age marriage. So that can create a challenge to the couple to cope up with the disease or to face the disease. This is a very big situation. Many nuclear family face these all problems. So let these Agni to continue, not here in the Putrashti Yajna. So the Putrashti Yajna, what Dasarath Raja has did. So all these Agni just try to preserve and keep on the Putrashti Yajna, so that can able to eradicate the disease of infertility, not from our country, from the whole globe. So saying thank you to all listeners. That is actually a happy man marries the woman he loved, but a happier man lost the woman he married. That's a message I like to give, because creation is always in the love itself. If you like to be an administrator, you like to be a pioneer, you like to be a leader, or you like to be a leader of leading leader, then love is the only one way. You don't need to get a chair. You don't need to get a position. It is just a love can do the solutions of every problems. This is my message of this day of celebrations by the the authority, the organizers. So thank you to all of you, and saying my regards to
excellent. Hats off as usual. Excellent. In very fast pace, you have excellent batted. Great, madam. Great. Very nice. You have covered almost all the factors involved in infertility and treatment, right from the drugs to theory and philosophy. So I would like to request now Dr. Baljot Kaur, and before Dr. Baljot Kaur, Professor and Head Department of Prasuti, Tantra and Stree Roga, Shaheed Kartar Singh, Sarabha, Ayurvedic Medical College and Hospital, Ludhiana. Welcome, madam. Welcome. Your screen is visible.
Thank you, sir. Yes, sir.
You can go for slideshow.
Yes, sir. Just a minute.
No problem. Please take your own time. Is there any problem, madam? Your screen is visible.
Yes, sir. But I just wanted to make it full screen.
नीचे होगा ना उसका नीचे. ये आपके मेल में है लगता है स्लाइड, गूगल स्लाइड में.
जी सर.
चलिए कोई बात नहीं है. ऐसे
नहीं
भी
सर,
आप
मेल में नहीं है सर, ये उसमें ओपन ही किया हुआ है सर. जस्ट अ मिनट. ओके.
kindly start, madam. No need of slideshow.
Yeah. With the blessings of Lord Dhanwantari, I thank Independent Research Society and Dr. Pawan, Dr. Madan, and all the dignitaries on the platform. And thank you for giving me this opportunity to share my views on ovulation and its Ayurvedic management case discussion. Bishnupriya madam has very elaborately explained about infertility. I will be discussing about anovulation. So anovulation is the most common etiological factor of infertility, with approximately 30% of all cases of female infertility. The causes of anovulation include hypothalamic failure, hyperprolactinemia, polycystic ovarian syndrome, premature ovarian failure, subclinical hypothyroidism, adrenal failure, and obesity. Out of these disorders, polycystic ovarian syndrome is the commonest, easily diagnosed, and most treatable cause of an anovulatory infertility, accounting for 70% of cases. Now, while describing essential factors for conception, Bij is one of the 4 essential factors for conception. It is said in Sushruta Samhita, Dhruvam Chaturanam Sanidhyat, Garbha Syad Vidhi Purvakam, Rutu Kshetra Ambu Bijanam Samagryat Ankuro Yatha. So, Bij is a very significant factor in fertility. Now, Acharya Kashyap has mentioned Antah Pushp for ovum. Expulsion of matured ovum from Bij Granthi or ovary is known as Bijotsarg or ovulation. And nowadays we are seeing many cases of anovulation. Now I will be discussing 2 cases. Now, the first case, this patient is 29 years old, female, with a height was 5'4", and she weighed 96 kgs. Her menstrual history was normal. Active married life was for 5 years. She was known case of hypothyroidism, and she was taking Thyronorm since last 2-3 years. So she before coming to me, she took many medicines. She had referred many doctors, allopathic as well as Ayurvedic, for 4 years, but was not able to conceive. So earlier she was a known case of PCOD also, and she was my student also. So with the regular treatment, her menstrual cycle got normal, but she was not able to conceive. Then she went for allopathic treatment for anovulation and went for ovulation induction drugs. But by taking those medicines, like she took treatment for 3 months, but ovulation did not occur. But she started having symptoms like stomachache, nausea, insomnia, and dizziness. So no follicles matured or ruptured. So when she came to me, she was depressed, anxious, with low self-esteem, and since she was obese, so every doctor told her, you have to reduce your weight, then only you can conceive. So she starved her body with the dieting, and but she was not happy with herself. So all her hormonal assay were normal, her AMH was also normal, but I told her to get her vitamin D3 and the CRP levels checked. So her vitamin D was very low at 14.13 and the CRP was raised at 25 mg. So, but after 1 month of treatment, vitamin D raised to 75 and CRP reduced to 10.98. For her vitamin D, I had started with the 60,000 unit vitamin D capsules weekly. So, and when she came to me, I just told her that you don't have to be worried about your weight. So you just be conscious about being healthy. So you don't have to take the diet. You just take the normal diet, like what we say at this as the Shadrasatmak Ahar, and with proper ghee and with whatever our India diet is, you have to take that. You have to include everything, all the vegetables, dal, and everything. And she had very disturbed sleep. She used to sleep by 2 or 3 o'clock, and then her sleep was not proper, and she used to feel very lethargic. So I just mainly focused on her lifestyle. I told her you are not going to think about conceiving for at least for 3 to 4 months. First, you have to become healthy. So first, I started with the Deepan Pachan. I started with Raspachak Guglu 1 TDS, Raspachak Yog tablet 1 TDS, tablet hemicordial 2 TDS, and syrup hemicordial 2 spoons TDS for 15 days. And then after 15 days, I started with continued with Raspachak Guglu, increased the dose with 2 TDS, then hemicordial tablet 2 TDS, syrup hemicordial 2 spoons TDS, and I added Sukumaram Ghritam. So because ghee is very important, we need healthy fat in the body for a proper function of the hormones. So in every infertility patient, I add ghee. That depends according to the status of the patient. So in this case, I started with the Sukumaram Ghritam because it will do the Anuloman aspect also and the Brihan aspect also, and Chitrakadi Vati for Ampachan. And since this anovulation aspect, especially related to the PCOD here, the cough and vata are vitiated in the Apan Kshetra. So there, and Pitta is in the Kshina Avastha. So we need that Dhatu Agni in the proper status. So I added Chitrakadi Vati 1 TDS, and moreover, like when I have to go for ovulation thing, I never use modern medicine. I have only used Ayurvedic medicine and I get very good results. And Chitrakadi Vati has very good results in ovulation induction. So I continued this medicine for 4 months. And after 1 month, she started feeling very comfortable. Her anxiety was very low and she could sleep properly. Her diet was also okay. Her digestion was also okay. And then her weight also reduced from 96 to 92 kgs. And she said that it has never occurred since last 5 years. So she was comfortable with that also. And in the month of December, she started her treatment in the month of May. In the month of June. In the month of December, ovulation study was done, which showed anovulation. The report is with this. Then after this ovulation study, I shifted to her on Pushpadhanvaras 1 TDS and Mahayograj Guglu 1 BD, Chandraprabhavati 1 TDS, and this combination I usually give for ovulation. Shatavari, Ashwagandha, Gokru, Yashti Madhu. in equal quantities, and 3 grams BD after meals. Then Sukumaram Kritam 2 Ts, then increased to 2 TSF twice a day and before meals, and syrup hemicordial 2 spoons TDS. And then Haritaki powder 3 grams plus gur. It was given at bedtime, and this treatment was also continued for 4 months till April 2019. And then after that, still Pushpadhanna was continued for 2 BD, tablet hemicordial 2 TDS, syrup hemicordial 2 spoons TDS, Chitrakadivati 1 TDS, Sukumaram Kritam 2 TSF BD. And with this medicine, with some unavoidable reasons, we could not go for another ovulation study. But with this treatment, she continued, and after 2 months of this treatment, her UPT was positive, and she conceived naturally. And throughout pregnancy, she took Ayurvedic treatment, she took Garbhini Paricharya, and she followed every instruction as I told her to follow. And her pregnancy was very smooth and very healthy, and she delivered the baby with a weight of 3 kgs. And this is the case number 2. This is age of the female was 32 years, height was 5'3", and weight was 72 kgs. Her menstrual history, menstrual cycle was normal. She had primary infertility since 8 years, and her active married life was not there, as her husband lives abroad. So she used to come once a year for 1 month or 2 months. And regarding chief complaints, she had indigestion when she came to me with white discharge per vaginum with foul smell before menses. And she was known case of hypothyroidism. And her hormonal assay was also normal. Her FSH, LH, testosterone, everything was normal. Then when she came to me, I am not having this report with me as at present. On 4th of January, her report said was like uterus was normal, but left ovary and right ovary were bulky and polycystic. So diagnosis was bilateral PCOD. So the treatment I gave her for 7 days with the Trifla Buglu, Avipattikar powder, and Arogya Vardhani Vati. Especially, I start all the treatments with Langhan, Dipan Pachan, and Ampachan. So, but after taking for 7 days medicine, she didn't come for 2.5 months. Then when she came, again, I started with the tablet Arogya Vardhani Vati, hemicordial tablet, tablet Needi, since it helps in the cystic follicles also, and then Avipattikar powder and Dashmula rest for 2.5 months. And on 30th April, we repeated the ultrasound, and her ultrasound was normal. They were her ovaries were normal. There was no bulkiness in the ovaries, and no polycystic picture was there, and her USG was normal. Then again, we went for a follicular study on 31st May, which showed her normal sonographic study, but there were no dominant follicles till the 14th day, and free fluid was present, but ET was 7.8 mm, which is not very appropriate size. Then we continued the treatment with Pushpadhanva Ras. Then M2-tone tablet was added. Tablet Yograj Guglu was given, and Falgrit. In this case, I added Falgrit as her menses were normal, and her digestion had also become normal. It was 1 TSF TDS, and Erantrish Haritaki was given at bedtime. And after that, we planned for Matra Basti, which was given for 8 days with Sehcharadi oil 60 ml. And in the next month, after menses, we started with Nasya with Mahanarayan oil, 8 drops in each nostril, was given for 7 days. And during this 2 months, the treatment given was Pushpadhanva Ras 2 BD, tablet Amtotone 1 TDS, Dashmul Quath was given 2 spoons TDS, and Apatya Grit was added. Because since there was no dominant follicle, so that needed good kind of nutrition or fat and good kapha for the proper maturation of the follicles. So that was given 1 spoon twice a day before meals. And during the Panchkarma procedure, the Grit was not given. It was after that. Then after that, first two Uttarbasti were given. First was given for 3 days with Dashmul oil, and second was given in the month of December for 3 days with Mahanarayan oil. Actually, this patient, her husband was not living here. He was supposed to come to India in January, but which also got postponed. So this patient, we were treating her so that when her husband comes, she is healthy and she has enough time to try. So then in the month of November, ovulation study was done. Their ET became 8.1 and right ovary had dominant follicle, and which ruptured on the 10th day. So and left ovary had no dominant follicle and free fluid is seen. So this anovulation case, it was we can say kind of chronic, and since last 6 to 7 years, ovulation was not happening even with the induction also. And in this case, these are the two cases of anovulation. Both of them were obese or overweight. In one case, only oral medicine, Shaman Chikitsa was given. And in this case, along with Shaman Chikitsa, Shodhan Chikitsa was also given. And in this case, and since in Punjab, most of the males, they are working abroad, they come for 1 month or 2 months. So the stress factor is huge on the female. So in my patients, I just suggest them that whenever their husband has to come, they just plan accordingly, that they come before mid-cycle, and when then they have to leave, it should be after mid-cycle, so they can, even if they come for 1.5 months or 2 months, you get 3 cycles for trying. So, though still the conception has to occur in this patient, but still I wanted to discuss that conception occurs as mentioned in the Samhitas also, that is, it is karma and kal and swabhav dependent. So that is also a part of treatment, that when the problem or the disease has been cured. So when treating Vandhyatva due to anovulation, factors to be taken into consideration are doshas, dhatus, mansik bhavas, dincharya, ratricharya, vegdharan, ahar, nidra. These are the, like, we have to treat patient as a whole. It's not just that she had come with a complaint, we have to treat that. No, we have to treat the patient as a whole. So when all these factors are in balanced state, they help follicle to be in Pushpibhut stage, that in the stage of maturation, and its pravartan, that is the release, occurs every month. So with Ayurveda, anovulation can be treated successfully. And in next few slides, I'll just give a short view about the doshas and dhatus involved. So whenever we are treating the female patient, all the dhatus are to be considered. We know about the ras dhatu; it is the main, and at that healthy ras dhatu formation depends upon the ahar dhatu they are taking. Along with ras dhatu and rakta dhatu, medo dhatu also has a very significant role. Like adipose tissue and lipids form the medo dhatu. Leptin in adipose tissue gives signal to HPO axis at puberty when appropriate body mass is achieved. So leptin has a permissive role. So decreased leptin leads to anovulation. So we need to have, it's not about being fat or being overweight or being obese. It's just about how good fat or how good the metabolism of fat is there in the body. So increased adipose tissue leads to decreased testosterone and higher estradiol, leading to male infertility. Like it works on male and female both. So we have to have good fat metabolism. Then coming to Majja Dhatu, Rakta Dhatu along with Ras Dhatu reaches all the organs of the body, helps in synthesizing their individual Dhatu, and finally reaching Sarakta Medas of Majja Dhatu. It is also referred to as seat of Vayu and nourishes Shukra. So from infancy to maturity, there is increase in fatty yellow marrow. In adolescence, the red marrow of long bones is converted to yellow marrow. So at puberty, fatty yellow marrow significantly contributes to extragonadal steroidogenesis, which activates the HPO axis at the time of puberty. And this the time of puberty, it leads to, and how we are managing the puberty will lead to the healthy reproductive body. Now, coming to ahar, it is said that Gritakshir Nityasu Muditasu Kafatmasu Artavam Tishriti Chiram Viparitavasto Anyatha. So they have said that we need Kafvardhak ahar, and mainly Grit Kshir. It is to be consumed regularly by at least by the female. So it leads to healthy artha, leading to healthy fertility. And here artha means the good endometrium and the ovum also. So, and increase in free radicals decreases the quality and quantity of oocytes. And nowadays we see that the ahar is not very healthy. So we have to work on that also. Then malnutrition delays puberty, and loss of weight due to abstinence of food, starvation, excessive exercise, chronic illness leads to catabolic state, which favors formation of 2-hydroxyestrone instead of estradiol. So this estrone inhibits gonadotropins. Moreover, with malnutrition, there is poor availability of estrogen receptors. So it's not just that patients, when they go for dieting, they are affecting their health also. Then coming to Nidra, it is very significant. We have to have proper sleep. It allows antioxidants to recover, heal the metabolic injuries. So during sleep, melatonin is released from pineal gland. It acts as a free radical scavenger due to its hydrophilic and lipophilic properties. Melatonin is seen in follicular fluid before ovulation and can act as an antioxidant in ovarian follicular fluid. So it also inhibits the excess release of estrogen from reproductive tract. Now here I want to add a point, like when we are not sleeping properly, and at that time we are on the phones or on the laptops, we are affecting our alochak pith also. And that since eyes are also part of majja dhatu, it is affecting the brain also. And when it is affecting the brain, or since it is also a majja dhatu, it is affecting the HPO axis also. So whenever we are treating a patient of infertility, especially an ovulation, we have to treat the patient as a whole. And in both these cases, I worked on their lifestyle, on their food, and on their stress levels also. So they were very comfortable, and especially in the second case when I did Basti, she could feel that she can feel light in the body. She was more active, and when we did Nasya, after Nasya, she said, I'm calmer now. I used to feel very irritated and angry, very on a small things, but now I'm very relaxed, I'm very calm. So Panchkarma, it works on the physical level, it works on the mental level, it works on the emotional level. So we have to treat the patient as a whole. Thank you so much.
Very nice, very nice. You have presented all practical clinical case history. Excellent.
Thank you, sir.
Very nice, madam. It is inspiring for others, practitioners attending the conference and who will be viewing later on YouTube channel. Excellent.
Yes, sir. So I just wanted to add the practical problems and how we have to deal with the patient, because mostly they will be, we go to the modern doctor or anywhere, you just reduce the weight. They will focus on the weight. So I'll just tell them that you don't have to focus on your weight, you just focus on your health, and that works wonders. And I don't tell them that you have to exercise for 1 hour or half an hour. I just tell them you start with 5 minutes. In a day for 2 to 3 times. You can walk, you can do yoga, you can do exercise, you just do mix and match. So that becomes easier for them, and then they gradually increase and they do better. Thank you, sir.
Thank you very much, madam. Before calling Dr. Sidheswar Sathua, our moderator, Sir Dr. Madan Thangavelu ji is here, Genome Biologist from Cambridge, UK. So I would like to welcome Professor Madan Thangavelu, sir, for his comments.
Apologies for joining.
Sidheswar Sathua ji.
My apologies for joining late, number one. My apologies also for leaving early today because our new Ayush professor is joined in the University of Latvia in Riga. And there is a scientific council meeting today, so I have to be there. But I want to congratulate both Bishnupriya ji and Madam for these amazing presentations. I have one or two questions here. I ask this here because we have many YouTube watch people who will come to this. I put the question in the chat box. The question is vitamin D levels. Hindustan, we see this as a major problem. Could you tell us a few words? The first case you showed, the vitamin D level is very, very both come. Do you see this in other patients also? Because I've discussed with our CSIR colleagues in Delhi, and they say this is a big problem in India. Thoda aur batana ji iske baare mein, unmute karke.
Yes, sir. So main thing is the lifestyle. We are not sitting in the sun all the time. We are inside. We are not. Our food is the main factor. Exercise is not there. So that this whole lifestyle, it is affecting the vitamin D levels. So even if we say vitamin D levels, it comes to the asti dhatu, majja dhatu. So if it is affecting that. So for that, because the people are not taking good fats, ghee is not being included, the diet is not very healthy. So all this lifestyle is affecting the vitamin D levels.
Baljot ji, what you have given us and what Bishnupriya has given us is a very lovely description of these biological systems. They are complex systems. They're not easy to understand. And you have touched on it very nicely. One point that you touched on is about husbands working in other locations and when they come to visit. And we have been discussing here other conditions, rheumatoid arthritis, inflammatory disease.
Yes, sir.
The same problem we see. Increased incidence of rheumatoid arthritis in families where the husband is living somewhere else and the women have this problem. So I'm grateful that you have shown us from Punjab, you have shown us some of the real problems, which are also universal problems. So this is a very important
thing. And sir, human patients may stress level or zyada badh jata hai ki time come hai, then we have to give results. So I just counsel them, I just tell them, like, you just enjoy the process. You are both are together. That is more important. Then other things will happen naturally.
So, my one last comment, because our senior professors are here, Bishnupriya ji is here, Bishnupriya ji is here, Agniotri ji is here. I just want to say कि इसकी तरफ अगर एक छोटा सा एक publication बनाए.
Okay.
It is at this interface between measurability and non-measurability. थोड़ा सा qualitative चीज भी है, थोड़ा quantitative चीज भी है. इसके ऊपर थोड़ा सा, please let us come together to discuss this one.
Sure, sir. Sure.
Thank you again for this wonderful presentation and the cases. If you have more case studies, I think Pavanji is organizing a series where we are discussing individual conditions, and Pavanji will be in touch with you, tell you a little more about those issues.
Sure, sir. So, thank you.
Pavanji, I just want one more comment for Bishnupriya ji and also for all the Ras Shastra people here with us. Bishnupriya ji ki presentation, aap bhi hai Ras Shastra se. Bishnupriya ji ki presentation mein, I'll put this question in the chat box. Stree Vyadhi Hari Ras. Now, itni complex formulation. And this is used routinely. So I don't know if Bishnupriya ji is still here. So it's a very complex formulation. इसमें पता नहीं कितने बस में. Bishnupriya ji, आपकी तरफ से, you have shown how effective it is. You have explained the mode of action. Why can't we take this one example to show efficacy and also the safety of this formulation. I don't know if anybody else other than Dudh Papeshwar make this complex formulation. Isme itni cheez hai, but you are using it so happily with effect. Iski baare mein thoda batana ji. I think we must collectively we must make some comments here. Ki itni complex formulation, usme itni bhasm pada, fir bhi it is used effectively, no toxicity, and all this kind of talk that is going on. So this is the second comment. And finally, Bishnupriya ji, I will put again in the chat box, non-linear systems. This is also very, very important to understand. We think all human beings are built the same way, but Prakriti concept tells us it is different. But this non-linearity, I think, takes us beyond the Prakriti concept also a little bit. There are some aspects. It connects very nicely with Ritucharya, Dinacharya. Some aspects are there where different people respond differently to these things. So these are three things I wanted to say. I want to thank, if Bishnupriya ji wants to add a few words about this, then our listeners on YouTube will be able to hear about this either now or in the question answer session. Pavan ji, there is a raised hand.
Yes, Dr. Ritima.
Ritima ji.
I would like to request to unmute her mic. Dr. Ritima, please, if you have any question.
Yeah. Thank you, sir, for giving me time. I'm really thankful. Sir, मैं जो मैम ने जैसे भी PCOD के 2 केस उन्होंने लिए, मैं उसी में से जो कृष्ण व्यक्ति होते हैं जिनके पतले हैं जो, और उनके अंदर आपको लीन PCOD के केस मिलते हैं जहाँ पे एमनोरिया भी साथ में मिल रहे होते हैं, जो कि जिन्हें हम वातज ज्यादा मानते हैं. तो उनके अंदर सर हमें किस तरह से चलना चाहिए? विद एमनोरिया, उनका एमनोरिया टूट नहीं रहा होता कि उनको मेंस्ट्रुएशन साइकिल नहीं स्टार्ट हो रहा होता.
मैम उसमें भी हमको सबसे पहले तो लाइफस्टाइल ही देखना है, और वो एक मेजर फैक्टर रहता ही है, चाहे वो ओबीस PCOD है या वो लीन PCOD है. जो ओबीस PCOD है उसमें जो कफ वृद्धि है वो थ्रू आउट बॉडी है, और जो लीन वाला पेशेंट रहता है उसमें वो अपान के क्षेत्र में ज्यादा प्रोमिनेंट रहता है. तो वहां पे हमको लीन पेशेंट पे देखो, जो मेरा लाइन ऑफ ट्रीटमेंट रहता है या जो मेरी थिंकिंग रहती है कि हमको धातुओं पर भी वर्क करना है. तो हमको जब हम रस धातु रक्त धातु पे स्टार्ट करेंगे, उसके बाद जब हम मेद अस्थि मज्जा धातु पे आएंगे तो अपने आप ही जो HPO एक्सेस है वो नॉर्मली फंक्शन करना शुरू कर देता है. तो उसमें हमको पहले तो जो हम दीपन पाचन से स्टार्ट करते हैं, पेशेंट को पहले आप लंघन थोड़ा दीजिए, फिर दीपन पाचन से लेकर के उसको आप उसमें हमको ब्रीहणीय द्रव्य भी यूज करने पड़ेंगे. उसमें हम जैसे शतावरी है, अश्वगंधा है, साथ में कौंच बीज हो गया, साथ में हम थोड़ा सा उसमें नागरमोथा और यष्टि मधु, ये वाला कॉम्बिनेशन भी अगर हम यूज करते हैं तो हमको बाकी और मेडिसिन के अकॉर्डिंग टू द पेशेंट अगर हम ऐड करते हैं, और साथ में घी आप जरूर ऐड करिए. किसी भी कोई भी फॉर्म है, दाढ़ी मादी घृत है, सुकुमार घृत है, फल घृत है या कल्याणक घृत है, मतलब घी आप किसी भी फॉर्म में उसको साथ में यूज करिए. बट इट टेक्स टाइम. वो पेशेंट को आपको थोड़ा सा काउंसिल करना पड़ेगा, उसको समझाना पड़ेगा कि इंस्टेंट रिजल्ट्स नहीं आएंगे, बिकॉज वी वर्क ऑन द बॉडी एज अ होल. तो वो उस पे थोड़ा सा जैसे वो फेमिलियल एस्पेक्ट भी रहता है, उसका जेनेटिक एस्पेक्ट भी रहता है PCOD का. तो इट टेक्स बिट ऑफ अ टाइम, बट विथ कंसिस्टेंसी वी गेट रिजल्ट्स, और पेशेंट को मेंसेस भी रेगुलर आने शुरू हो जाते हैं.
Thank you, madam. As per our format, question answer session is in the last of presentation, so flow will be maintained. If you kindly excuse me, I will definitely invite each and every audience, whoever has raised the hand or whoever has any curiosity in the mind, definitely we will invite. But to maintain the flow and pace, please allow me to invite very senior Dr. Sidheswar Sathua, Professor and Head, Department of Prasuti, Tantra and Stree Roga, Govt Dhanwantari Ayurvedic College and Hospital, UJJAIN. Welcome.
Sir, namaskar.
Namaskar, namaskar.
Welcome and namaskar, pranam to all. In this, 317th webinar. I want to give special welcome to my classmate, Dr. Professor Bishnupriya Mohanty and other eminent speakers of this Sambhasa under the heading of Ayush Samriddhi. Our Doctor and Professor Dr. Kaur Madam, Dr. Madhura Madam, Dr. Renuka Madam and others. Lastly, I thank to the host of the program, Dr. Pawan Sharma ji, President IIRES, who invited me in this important debate. मेरे को जब पवन शर्मा जी फोन किए बोले सिर्फ 15 मिनट के लिए बोल, मैं खुश हो गया, ठीक है 15 मिनट के लिए कुछ ही बोल दूं, लेकिन इतना इम्पोर्टेंट एक वेबिनार में कुछ भी बोलना मेरे लिए संभव नहीं हो पा रहा है। बस मैं हमारा संस्था के बारे में थोड़ा सा बोलना चाहता हूँ। मैं मेरे संस्था में 2002 में उज्जैन में ज्वाइन किया, तब मैं कोशिश किया मेरे संस्था को एक डिलीवरी पॉइंट के रूप में प्रतिष्ठा करने के लिए। तो वो सक्सेस में हुआ 2017 में। लगभग 10 साल संघर्ष करने के बाद 2009 से 2017 8 साल संघर्ष करने के बाद डिलीवरी पॉइंट जो कि गवर्नमेंट ऑफ इंडिया की तरफ से वो डिक्लेयर हुआ। आज की डेट में हर महीने 80 से 100 डिलीवरी होती है, हर साल 500 से 1000 डिलीवरी होती है और रोज हमारे ओपीडी में 40 से 50 मरीज आते हैं। और वो जो मरीज आते हैं मैं देखा आंकड़ा उनका लगभग 80 से 85% वो ANC पेशेंट रहते हैं डिलीवरी वाले, और अदर गायनेकोलॉजिकल प्रॉब्लम है 18%। और एवरी डे वी फेस 2 to 3% ऑफ इनफर्टिलिटी पेशेंट। और जो डिलीवरी पेशेंट आते हैं हम उसको हमारा जो NRHM की प्रोटोकॉल के तहत दवाई भी देते हैं, इसके अलावा हम आयुर्वेदिक दवाई देते हैं। और उसमें मैं एक चीज आयुर्वेदिक की शुरू किया, जैसे ही 37 वीक की हो गया तो हर महिलाओं को मैं दशमूल क्वाथ और बल्ला तेल की बस्ती देना शुरू कर देता हूँ। उसमें उनको एक मेंटली सेटिस्फेक्शन रहता है कि मेरा डिलीवरी नॉर्मल हो जाएगा, और शारीरिक रूप से भी उनको जो भी होता है वो भगवान धन्वंतरी को पता। मोड ऑफ एक्शन ऑफ आयुर्वेदिक मेडिसिन इज स्टिल इन डाउट। मैं कभी कभी सोचता हूँ या देखता हूँ आयुर्वेद में आयुर्वेद दवाई काम नहीं करता, आयुर्वेद दवाई मिराकिल करता। और मैं भगवान धन्वंतरी को ये आशीर्वाद मांगता हूँ, हे भगवान हमको ये आशीर्वाद दे और हमारा दवाई में इतना ताकत दे दे ताकि हमारा दवाई काम नहीं करेगा, वो मिराकिल करेगा। तो मिराकिल भी हो रहा है। नॉर्मल डिलीवरी आज जो भी पेशेंट आ रहे हैं उनमें 80 to 90% नॉर्मल डिलीवरी होती है। और उसमें जो इनफर्टिलिटी पेशेंट जो आते हैं हमारा संस्था में, उसमें हम उसको डिटेल हिस्ट्री लेते हैं। 2-4 पेज हम फॉर्मेट बनाए हैं, जामनगर से लाए हैं वो फॉर्मेट। और उसको हिस्ट्री लेने के लिए 2 घंटे लगता है। दोनों कपल को बैठा के उनको बढ़िया हिस्ट्री लेते हैं। हमारा इंटर्नी से भी हिस्ट्री लेते हैं। इसके बाद हम उसको पंचकर्म के लिए भेज देते हैं। मेरा बात सभी को सुनाई दे रहे हैं ना? हेलो शर्मा जी।
हाँ जी, we can hear you.
हाँ
साथुआ जी, we can hear you clearly. बहुत बढ़िया।
ठीक है। तो उसको पंचकर्म के लिए भेजती है। 1 महीने के बाद हमारे पास आते हैं पंचकर्म करके, फिर हम उसको कुछ दवाई देते हैं। और अगर दवाई से ऐसे करते करते हमको 2-3 महीने हो जाते हैं, फिर उसको 3 महीने के बाद उसमें से कुछ ओवुलेशन स्टडी जो भी है होता है, और कुछ महीने में वो प्रेग्नेंट भी हो जाते हैं। और जो नहीं होते हैं फिर हम उनको उत्तरबस्ती देते हैं। ये फाइनल ऑप्शन रहता है। उत्तरबस्ती में हम अपमारक क्षार तेल देते हैं, और तो अभी तक शुरू नहीं किए। और जो दवाई में हम दशमूल क्वाथ देते हैं, शतावरी अश्वगंधा देते हैं, और जो भी दवाई है वो देते हैं। और मेरे को अभी तक जो देखा मैंने 30 to 40% रिजल्ट मिल रहा है। मैडम जैसे एक केस दिखा रहे थे, मेरे को तो वो संभव नहीं है 15 मिनट में। तो मेरे को जस्ट 15 मिनट लेना है। as per our science, it is the condition of बंध्यात्व, failure to achieve a successful pregnancy and offspring. हमारे आयुर्वेद में जो डेफिनेशन बंध्यात्व को वो अलग है। अगर किसी को प्रेगनेंसी नहीं हुआ या बच्चा नहीं है उसको हम बंध्यात्व बोलेंगे। इसीलिए गर्भस्रावी, मृत बच्चा, ये सभी को हम इनफर्टिलिटी में काउंट कर दिया गया हमारा आयुर्वेद में। आयुर्वेद में जो इनफर्टिलिटी वो अलग तरह से अप्रोच आयुर्वेद करता है। अगर मॉडर्न के दृष्टि से देखें तो दो फैक्टर है जो मेल है और फीमेल है। फीमेल में ओवेरियन, ट्यूबल, यूट्राइन, जेनिटल ट्रैक्ट, पीसीओएस, एंडोमेट्रियोसिस, ये फीमेल में होता है। मेल में डिफेक्ट इन अदर either sperm production or sperm transport due to varicocele, infection, ejaculation problem, जैसे retrograde ejaculation में से होता है, coitus तो होता है, सभी erectile erection होता है, सभी होता है, लेकिन जो ejection होता है sperm बाहर नहीं होके ब्लैडर में होता है। तो ये सभी साइकोलॉजिकल प्रॉब्लम है, कुछ हार्मोनल इम्बैलेंस है मेल में, फीमेल में। तो महर्षि सुश्रुत का डेफिनेशन के बिना हमारा बंध्यात्व इम्परफेक्ट रहेगा। ध्रुव चतुर्णांग सान्निध्यात गर्भस्यात् विधिपूर्वक ऋतु क्षेत्र क्षेत्रम अम्बु बीजानां समग्रात अंकुर यथा। तो महर्षि सुश्रुत गेव इंपोर्टेंस ऑफ ऋतुकाल, जैसे फर्टाइल पीरियड, टाइम ऑफ ओव्यूलेशन। आज नो महीने में एक दिन महिला एक दिन जो कि ओवम उसका जिंदा रहता है, ऐसे साल में सिर्फ 12 दिन। अगर हम महीने में एक दिन यूटिलाइज नहीं कर पाए तो उस महीने गया। तो ये जो फर्टाइल पीरियड का इंपोर्टेंस हम कपल को बहुत समझाते हैं, हाउ टू यूटिलाइज द फर्टाइल पीरियड। इसलिए हमारे आयुर्वेद में प्रतिष्ठित यज्ञ लिखा है, वो कितना महीनों तक प्रिपरेशन करना पड़ता है एक अच्छा बच्चा पाने के लिए। तो जो लाइफ स्पैन ऑफ ओवम इज ओनली 24 आवर। तो इसलिए इसको पहले हम उसको कपुल को बुला के उसको दिमाग में बैठाते ये चीज कि इस पीरियड को कभी मतलब खराब नहीं करना है अपन को। तो इसीलिए पुत्रिष्टि यज्ञ से पहले मेल को मधुर, सिक्त, शुक्रवीर्यक द्रव्य और शुक्रवर्धक द्रव्य, मेडिसिन रेजिमेन, घी, मिल्क, शुगर, मीट सूप, जूस और इरेक्टाइल डिस्फंक्शन के लिए हम बाजीकरण दवाई और एनकरेज करते हैं इनको। और फीमेल के लिए अम्ल, लवण, आग्नेय द्रव्य, मेडिसिन, एक्टिविटीज, ऑयल और फेस शावर सब्सटेंस, मस्टर्ड। तो ये सभी ओवुलेशन के लिए हम देते हैं। क्षेत्र में हमारा दो क्षेत्र है, हमारा आउटर इन्वायरमेंट और इनर इन्वायरमेंट। आउटर इन्वायरमेंट शुड बी फेवरेबल। ऐसा नहीं है कि सास रोज उसको महिला को और आरोप कर रहा है तुम्हारा बच्चा नहीं हो रहा है, और सोसाइटी का जो ये है, और एक्सटर्नल पॉल्यूशन भी इतना दुनिया में हो गया है। तो उसमें एक माता को या एक पेरेंट्स को माँ बनना, बाप बनना एक बहुत मुश्किल काम हो रहा है। इसलिए इन्वायरमेंट को क्लीन रखना है। अंदर का इन्वायरमेंट में यूट्रस, रिप्रोडक्टिव ऑर्गन ये हेल्दी होना चाहिए, और एक्सटर्नल इन्वायरमेंट में उसका कोई तनाव नहीं होना चाहिए और शुद्ध होना चाहिए। शुद्ध इसलिए देखिए, जैसे शुक्र शोणित संयोग उसमें नहीं होगा, इसमें जीव भी एक भगवान का आशीर्वाद भी चाहिए। तो इसलिए कोई भी इनफर्टिल पेशेंट आते हैं, मैं उनको पहले बोलता हूँ इधर हमारा बाबा महाकाल है, पहले जाके महाकाल के पास जो एक नंदी है, उस नंदी के पास जाके अपना सिर को ठोको जाके, और रो के जाके वो नंदी के कान में बोल के आओ, मैं क्या गलती किया था, कौन सा पाप कर्म किया था, कौन सा प्रायश्चित का फल ये है, आज तक मेरे को बच्चा क्यों नहीं दिया। आप विश्वास नहीं करोगे, मिरेकल हुआ है मेरे साथ, 7 साल तक उनका बच्चा नहीं हुआ था, बच्चा हुआ है। तो ये चीज एलोपैथी में नहीं हो पाता। तो इसीलिए जो है जीवो, शुक्र शोणित जीवों के संयोग में जो बच्चा आता है, तो पहले वो आत्मा का और भगवान का आशीर्वाद बहुत जरूरी है। इसके बाद आया अम्बु। कारण बंध्यात्व के लिए, और अन्न को ब्रह्म बताया गया है ऋग्वेद में। तो इसलिए अन्न को हम ऐसे लेना चाहिए, जिसको बच्चा हो रहा है तो वो अन्न को ब्रह्म जैसा लेना चाहिए, जुडिशियसली लेना चाहिए। खाली अन्न हमको फिजिकल, मेंटल, स्पिरिचुअल हेल्थ में भी हेल्प करता है, और हमारा ओवुलेशन, हार्मोन सब रेगुलेशन करके करता है। बंध्यत्व का एक काम, सभी रोग का बंध्यत्व को वात रोग में वर्णन किया गया है, और वात रोग का कारण जो भी है अग्निमंद्य है 220 में है, तो इसलिए अग्नि। और नेक्स्ट आया थर्ड स्टेज में बीज और शुक्र, जेनेटिक फैक्टर, वो दोनों का पूर्व जन्म को पाप कर्म नहीं होना चाहिए। और
आपकी आवाज नहीं आ रही है डॉक्टर।
पवन जी आवाज कट गया लगता।
कनेक्शन कट गया लगता है।
हाँ,
Are we audible to you, Dr. Sathua ji? He is disconnected or his?
पवन जी हमारा आवाज आ रहा है ना?
आ रहा सर।
शाबाश।
सतुआ जी आप म्यूट हैं। प्रोफेसर सतुआ जी आप म्यूट हैं।
हाँ ठीक है। हो गया सर? हाँ सर, सुनाई दे रहा हूँ मैं?
हाँ बिल्कुल।
थोड़ा अगर आपके मोबाइल फोन थोड़ा सा करें जी, थोड़ा सा चेंज करें फिर तो हाँ थोड़ा बस आ गया। शाबाश, थैंक यू।
तो सर ये सभी जो एब्नॉर्मल जो स्पर्म है, जो अगर हम आयुर्वेद में मॉडर्न वाले भी 100% नहीं दे रहा है, कोई सोसाइटी में 40% भी रिजल्ट दे रहे हैं, तो वो भी आयुर्वेद के लिए मिरेकल है। तो इसीलिए मेरा एक सुझाव है, हमारा टोटल आयुर्वेदी लोगों को या आयुर्वेदिक जगत को इतना डिस्करेज नहीं होना है। अपन को अगर मेथोडिकली ये सभी काम करना है, मैं सोच रहा हूँ जो हमारा संस्था में बढ़िया मैटर्निटी खोला है। अभी एमपी गवर्नमेंट ने हमारा कॉलेज को इनफर्टिलिटी सेंटर बनाया है पूरा स्टेट का, तो उसका नाम मैं दिया हूँ। खाली इनफर्टिलिटी नाम में पेशेंट नहीं आएंगे, इसलिए मैं उसका नाम दिया हूँ। सेंटर ऑफ एक्सीलेंस से बनने जा रहा है। सेंट्रल गवर्नमेंट है, हमको अगर सैंक्शन हो जाएगा हमारा कुछ करोड़ों में हमारा सैंक्शन आएगा, हम और उसको अच्छी तरह से डेवलप कर पाएंगे। तो मेरा बात ये कहना है, एक ही बात है कि हमको लगे रहना है। इतना 100% रिजल्ट किसी को नहीं मिलता है, अगर 40% रिजल्ट मिलता है वो हमारे लिए बहुत है। मेरे को बोला गया था 15 मिनट, मुझे लगता है 15 मिनट हो गया है। और पवन जी को मैं धन्यवाद देना चाहता हूँ, ये 15 मिनट का टाइम दिए मेरे को बोलने के लिए। और आप लोगों सभी को धन्यवाद। अगर मेरा
बहुत बहुत
अच्छा
धन्यवाद आपका, बहुत बहुत धन्यवाद जी, बहुत बहुत धन्यवाद।
थैंक यू।
आपने संक्षिप्त में सब कुछ क्लियर किया। बंधत्व तो आपका एक्सपीरियंस बोलता है। डेफिनेटली आई वेलकम यू एंड आई वुड लाइक टू वेलकम यू अगेन ऑल्सो। थैंक यू डॉक्टर, थैंक यू वेरी मच। I would like to request now Dr. Madhura Kulkarni ji, Ayurvedic Gynaecologist, Director, Sruja, Speciality Clinic for Women from Mumbai. Welcome, Dr. Madhura Kulkarni ji. Welcome.
Namaskar.
Namaskar, madam. Namaskar.
Thank
Your
you.
PowerPoint is with me.
Yes. Thank you, Dr. Pawan Kumarji. Thank you, Ayush Samriddhi. I'm very happy today because Russia has started celebrating Women's Day from 23rd February. And today we are here talking about the topic infertility, related with the most creative part of the womanhood. I'm very happy to see Professor Dr. Madan Ji, who is mentor of ours. We have seen and heard you lot many times, and very happy to present my short presentation regarding treatment of infertility, and I will be sharing my 30 years clinical experience regarding infertility. So what exactly infertility is? Actually, my patients taught me infertility long back when I started my practice. I still remember initial days of my practice, and one of my patients from UK, she sent me a message that I want a perfect remedy with Ayurveda. Like I have low AMH levels, and I cannot take medicine directly from you, but I want certain dietary changes, and I want to raise my AMH. So that was a real challenge for me. And a 35 years old female having low AMH, so the infertility, all other reports were normal, and simply I prescribed lotus oil nasal instillation, and I sent a lotus oil made of lotus panchanga, all 5 parts of the lotus herb, a single herb treatment along with certain pranayam and even dietary modifications. And after 6 months of the treatment, her AMH levels were improved, and even she got conceived. So that was the first lesson to me that infertility is not mere a treatment, but it is a management. Next slide, please. It's a management at its whole. It's not an absence of fertility, but psychological disorders, personal health, social health, and it reflects on even other diseases, even interpersonal relationship. And maybe she's presenting to us with infertility, but maybe she's having certain other underlying causative disorders. So even if patient is coming to us with the complaint of infertility, we need to screen the patient, both the couple, thoroughly. Next slide, please. So today's era, there are lot many treatment options are available, from IUI to surrogacy, IVF, ICSI, lot many technological developed concepts are available. Next slide, please. Hello, next slide, please. But when I'm talking in a holistic approach and representing Ayurveda, from concept to practice, my practical views are literally, I learned them from my patients, and it helped me to treat, or I think I can say manage, many of my patients. Next slide, please. So, as we know, the hormonal disorders are related with the HPO axis, hypothalamus, pituitary, and ovarian axis. I always see into my, I always treat my couple presenting with the infertility HPA axis. The H for hope, P for patience, and A for acceptance. So that HPA for myself as a doctor or clinician, a treating doctor, and even the part of patient. So all three, how we can give with the proper diagnosis. Diagnosis is the most important factor related with the infertility, as proper diagnosis can lead to the proper treatment module. So I will be talking here today for only female infertility. We treat both male, female, and sometimes the both couple related problems. Today I'll be talking about concept to practice, Ayurveda view, And the diagnosis part is the most important part, because we can predict even the time period of the treatment module. Because when the couple come to you for treatment aspect, they always have three questions in their mind: whether it is curable, whether it is treatable, how long it will take, and whether I will get a normal child. So late age pregnancy, they are like always conscious, and even they are like anxious that whether I will get a normal child or not. So diagnosis is important. And here concept of Ayurveda in a different modality always helps us to the proper direction of the treatment. Like Vandhya Nashtartava Vidya. So Nashtartav or Artav. Artav Ruto Bhavati Artavam. Actually, Raja, Artava, Bija, all these concepts from Ayurveda indicates a proper diagnostic value along with the pathophysiological findings or the like sonography or radiological findings. We need to correlate both the things, and that helps us to diagnose the disease in a better manner. How we'll discuss in our later slide. Next slide, please. So if I will just give you in point how I go for my treatment in female infertility. Uttar Bastantam Sanshuddhi. So diagnostic module, you need to examine the patient thoroughly with Raja, Artava, Rutu, that is ovulation period, that is menstruation, that is the cyclical bleeding, that is cervical secretions, ovulations, all the things, diagnostic value along with the different concepts from Ayurveda, and treatment module, Panchakarma, Uttar Bastantam Sanshuddhi, the total thorough Panchakarma ending with Uttar Basti. Next slide, please. Next slide, please. Shandi Duratikrama. So prognosis also you need to diagnose well in advance. Next slide, please. I want to discuss my module of Supraja. Next slide, please. So here we are, concept to practical aspect. Artha Parikshan, Prakruti Parikshan, and Lakshan Samprapti. These are the three main points from my treatment module, from my diagnostic module, which I offer to my couple who are presenting with the infertility. So pathological findings are always related with the second day of the menstrual cycle, LH, FSH, and even the TSH value, and certain vitamin deficiencies also lead to certain hormonal imbalance, and even thyroid function test. So all these things to assure whether the patient is having hormonal harmony and whether she will carry the conception towards the progressive pregnancy. So for this pathological conditions of Rakta Parikshan, we always, as a holistic point of view, do the Artho Parikshan, that is the menstrual fluid Parikshan. That is, you need to rule out symptomatically all the inhibitions, all the problems, all the dushtis, all the toxins secreted, and which is like we always call that Antapushpa Parikshan, Bahipushpa Parikshanat, means whatever things are coming out, we need to understand the consistency. There are certain tests we have developed for this Artho Parikshan, and these tests indicates the Antapushpa Dushti, means whether the endometrial thickness is properly maintained, whether the ovulation or the quality of ovum is properly maintained, and for that the Artho Parikshan is important symptomatically, and kind of tests we have developed. Prakruti Parikshan is always useful, as Kapha Prakruti is always like prone for proper ovulation, and we have seen and we have conducted one study that Kapha Pradhana Prakruti women always conceive faster and they retain the conception properly. So the Prakriti Parikshan is also important, and according to Prakriti, we have to give certain different kind of medicines also. And Lakshan Samprapti, that is when the cyclical bleeding or cyclical pattern of menstruation is occurring, all the hormones are playing a methodological role in the all the in all the sequence wise. So we need to understand which lakshan is represented and how we need to rule out the disturbed pathophysiology and how we need to choose our herb or choose our medicine properly. Like, I will give you the example when we are talking about the PCOD patient having an ovulatory disorder, when the patient is representing with the hirsutism and increased testosterone, lean patient, we need to give the medicine Nagakeshar, Nagapushpam, Kashayoshnam, Ruksham, Lagu, Amapachanam. So Nagakeshar is used when the patient is lean and when the patient is obese and having insulin resistance pattern, pathological it is shown, we need to glide her medicine, and for that we always use Chandra Prabhavati, Shilajit, Lekhana Dravya. So Lakshan Samprapti is very important, and there is always a small line, distinguished line, whether which patient is with the presenting symptom of the patient and underlying pathophysiology. And we need to compare it with the modern available technological findings. Then we can show the patient, see, your serum insulin level was this, and after our medicines, the serum insulin level has gone down, and definitely we are progressive and you will get the result. Next slide, please. Next slide, please. So this is Sruja protocol. This is what we have developed in these 30 years of clinical experience. That is Rutu Nusar Shuddhi. Panchakarma is definitely has certain role in the treatment of infertility in female. What we have done, like 3 parts of the menstrual cycle, immediately after the menstruation, the kapha dosha prominent, kapha dosha is prominent, and then 5th, 6th, 7th day of the menses, we give Sadhyo Vamana. After that, in between 12th to 14th day of the menstruation, when ovulation occurs, we give Virechana, Virechira Pruthak Bhave, and we have seen good results for the proper ovulation pattern 12 to 14 days of the period. And then premenstrually, we give Matra Basti or sometimes Yoga Basti. Basti definitely helps patient to it cleans the intestinal flora and the villi from there. It I've observed that certain micronutrients get absorbed more powerfully after certain lubricant bastis. So we have database of certain patients that vitamin B12 absorption when leads to infertility, decrease of vitamin B12 leads to infertility after basti. Definitely this absorption is improved and the quality of ovum is improved. So that Rutunusar Shuddhi, this is the Sruja protocol we are following. Next slide, please. Next slide, please. So certain medicines also I use, I think for students, and it will be useful. Ovulation disorders, Swarna Malini Vasanta for 5 days from 5th day of the menses to 10th day of the menses gives better result after the Panchakarma cleansing. Next slide, please. Low MH, Vasanta Kusuma Ras, and even Lotus Panchanga, what I have already referred to my case. Next slide, please. Tubal blockage, that is, we have developed BB capsule, Shilajit plus Bangabhasma. And I've seen, in tubal blockage, it's very difficult when the tube is only a hair, like it's a hair can pass through the tube. It's a structure. It's बहुत छोटा structure है. Or even if surgically we remove the block, sometimes adhesions or sometimes the infection, it doesn't allow patient to conceive naturally. And we have many options nowadays with tubal blockage that we can give proper results for the infertility causing by fallopian tube blockage. But trust me, I have a database of my patient where patient cannot opt for the operative process, or when some of my patients failed to conceive after the operation, मूषक तेल plus bala tel, sometimes phala group, depending on the patient to patient, this मूषक तेल have definitely a good role in cleansing Uttar Basti, cleansing the obstruction. And Shilajit always like anti-inflammatory and Rasayan gun. Bangabasma also an anti-infective role. And I've seen not even this oils clear the blockage, but it improves the quality of absorption of the quality of absorption capacity of the fallopian tubes. So definitely certain we can do a research on this tubal blockage with Mushak Tel Uttar Basti, and even this BB capsule, they have given me nice results. Even the patient having tuberculosis, post-tuberculosis tubal blockage, and these absorption of the infection was observed in a nice manner. Next slide, please. Low libido, Chandraprabha Vati or Shilajit or Makardhwaj, even Makardhwaj in female patients have used. And these common symptoms along with infertility, sometimes because they try and they literally get upset, and psychological emotional disorders, and after certain times I've observed clinically that female is literally in depression because she wants to conceive, and the things thing not allowing her to even have contact. So next slide, please. Makardhwaj, Chandraprabha, Shilajit, certain drugs you need to understand for endometriosis or PID, Trifagugul frequently I use means 2 tablets, even 4 times a day. We conducted a research at Podar Institute, Mumbai, that Google, we can give even 12 tablets in a day, and it's for even 6 months to 1 year. And even with Dr. Rama Vaidya and Dr. Ashok Vaidya, we conducted a research at Spark regarding this Google Kalpa. Next slide, please. Efficacy of Google Kalpa. So in endometriosis and PID, cervical erosion. Next slide, please. I won't go into detail because my time is going up. Next slide, please. Prognosis is most important. Next slide, please. See this thing, I will end up my talk with this study of mine, that we need to concentrate on the early detection of this infertility, because it's not only mere infertility, but it's a group of diseases. It's not only one disease, but see, simple PCOS can convert into insulin resistance, then diabetes during pregnancy, then even the diabetes to that baby in future. And this can cause really tremendous havoc on social health. So we need to treat this PCOS at early age, because I've seen many patients of premature ovarian failure. So lifestyle modification, we need to make our adolescent girls to understand what is the importance of her menstrual cycle, ovulation, and even all the things. And that is very helpful. Congenital disorders, we need to detect it at earlier stage. I've seen one of my patients having dysmenorrhea, treated by many doctors. Finally, when she couldn't conceive, it was like septa uterus, means it was congenital disorder, and then we had to treat it at later age. So early detection is important. Next slide, please. Next slide, please. So infertility is not only a treatment, it's a management. Management for personal health, social health, and betterment of society. So all together can make wonders to treat these patients in a different manner. Next slide, please. Thank you very much. Thank you. I'm open for the question and answers.
Excellent, excellent, madam. Very nice. Thanks.
Sorry for the time.
Nicely explain and practically explain everything. Excellent. Great, great. Now, before question and answer session, and after Dr. Renuka Mahesh Kulkarni ji, we have Dr. Avdish Pandey also. So we will invite him after Dr. Renuka Mahesh Kulkarni ji. I welcome Dr. Renuka Mahesh Kulkarni ji, Ayurvedic infertility expert, specialized clinic for women's health and infertility, Pune. Welcome, madam. Welcome.
Namaskar.
Namaskar, madam. Namaskar. Swagatam.
First of all, I will like to thank Dr. Madan Thangavelu sir, then Pawan Kumar Sharma sir, Dr. Agnihotri sir, and all the dignitaries, Dr. Bishnupriya ji, Dr. Baljot Singh, then Dr. Madhura Kulkarni, Dr. Rajan Patankar sir. I will like to thank for giving me this wonderful opportunity to share my views on this huge platform. I'm starting sharing slides. Yeah, I'm also practicing from Pandharpur, Maharashtra, Solapur. So we will start from the prayers. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Today's topic is treatment of infertility. As we discussed all, the same treatment module will not be useful in each and every case. We work more, as a Ayurveda, we work more on customized. So if you want to communicate me for further questions, you can take a screenshot. Now, there are many aspects of this infertility, but the time is short, so I will not elaborate all the things. Not many women are not willing to conceive. Socio-ecological factors are there. Career, they are having their own career. They are having their financial freedom. They don't want to lose their financial freedom. Then there are some fantasies about the enjoyment of life. So they use different kind of, actually her body is bombarded with the different kind of hormones. Then nowadays, nobody is going to take the responsibility. Number of divorces is also increasing. Extramarital affairs are also increasing. Then phobias are there. You can easily observe in the society, natural delivery phobia is there. So number of seizures are increasing. Many women feel that they will lose their hourglass figure. Some are having phobia of intercourse also. Some are having the phobia of pregnancy also. But our today's topic, we will focus on willing but not getting pregnant. There are primary, secondary infertility, we can say it as a kakavandya, and habitual abortions, we can say it as a garbhastravi vandya, that is habitual abortions. Then what Ayurveda says about the woman health, the problem areas are Rutu, Kshetra, Ambu, and Bija. Then you all know the shlok, famous shlok of Sushruta Acharya, Dhruvam Chaturnam Sannidhyat, Garbhasyat Vidhipurvakam, Rutu Kshetra, Ambu, Bija, Samudrat, Ankuro Tartha. So for the formation of the fetus, the first, he gives the classical example of the farmer. What the farmer does, if he want to sow a seed, he first cleans the soil, or removes all the debris, that is earth primordial element, pours water on it, prepares mud, then select a good quality seed and embed it in the mud and allows the sunlight to fall on that seed. So due to Tej primordial element, conversion occurs, and after that multiplication of the cells occurs with the help of Vayu Mivajayati, and then Akash gives the space for sprouting, and this is actual the formation of the fetus. Now I listened the vision of Dr. Madan Thangavelu sir. So Ayurveda and modern science, there is she want to build a bridge. And actually this happens when I'm practicing for the 30 years. Patient come to our clinic with the piles of file. There are many reports with her hand. So we have to according to my experience, it may be limited, and my knowledge, I have classified it into four parts. Rutu, that is Raja Pravartan. Then we have to see about the actual Raja ka parikshan hona chahiye. Jo is it blackish, graphic, foul smelling? तो रज से ही आर्तव का अनुमान निकलेगा. स्कैंटी मेंसेस है क्या, हेवी मेंसेस है क्या, रज प्रवर्तन का इतिहास अच्छी तरह से लेना है. Irregular menses है, delayed menses है, और no menarche. Then polycystic ovarian syndrome. We are saying it in the two ways. It is a lean or obese. We can say it as a santarpanjanya and apatarpanjanya. So one is kapha pradhanatva, and second one is apatarpanjanya, that is vata pradhanatva. Endometriosis, it is actually, these are vata vikruti. Endometriosis, endometrial cyst, excessive thin endometrium or excessive thick endometrium, and torch test positive. You all know that TORCH, different kind of hormones, different kind of viruses are there, and we have to give Uttarvasti for removing this. Migarbha Shodhan Uttarvasti अच्छी तरह से इफेक्ट देता है. Then क्षेत्र की विकृति है. Sometimes we have to intervene with the help of surgical intervention. Septate uterus है और central septate है, तो we have to intervene it with the help of surgery. सब कुछ आयुर्वेद के हिसाब से कर सकते हैं, ऐसा नहीं है. Acutely antiverted और acutely retroverted uterus है. आयुर्वेद में इसका नाम अंतर्मुखी होता है. Pinpoint os है, सूचीमुखी योनिव्यापत. Short cervix, elongated cervix. In Ayurveda, we say it as putragni, but this is ruled out can be due to the invention of Caesar. So putragni योनिव्यापत can be ruled out. Then cervical cyst है. अभी तो क्या आता है, नेबोथियन cyst आते हैं बहुत. Cervical polyps है. Small size of uterus है, small size of uterus, size of ovaries है. This can be cured if it is diagnosed in time. Before early diagnosis, very, very important. Dr. Madhura madam throw some light on this aspect also. And kshetra, tubal blockage. According to my practice, Uttarvasti plays very important role in tubal blockages. And if it is also from the fundal side, it is corneal side and fundal side. The fundal side is very easy to open, and if it is on the femoral side, it is hard. And if it is associated with adhesions, you can use Trifada Google along with it. Then due to ectopic gestation, one-sided tubectomy is done. Adhesions are there. Endometriosis grade 1 to 4, endometrial cyst, adenomyosis. Excessive thin endometrium, excessive thick endometrium, pelvic infectious disease, cervicitis, cervical erosions, torch test positive, AIDS, herpes zoster, cytomegalovirus infection. Vaginal pH. Nowadays, in each and every infertility clinics are doing PCT, that is post-coital test. Here, I think that they are doing vaginal pH, because vaginal pH, if it is acidic, otherwise in Ayurveda, according to Ayurveda, we can see Shukram, Saumyam, Shitam, and Artavam, Agniyam. And if there is some kind of heat in the vagina due to any kind of primordial elements deformity, then the Shukra will be dead in the vagina only. And when this occurs, we have to think about the Tej primordial element in that patient. Then excessive thick hymen, fibroid, CA ovaries, and uterus. These are all the problem about the kshetra. Then Ambu. Ambu is the holistic nourishment of the complete body. We can call it as a water primordial element in the body, that is the hormonal levels like estrogen, progesterone, follicle stimulating hormone, LH, serum estradiol, prolactin levels, thyroid levels. Then due to oral contraceptive pills, copper T, these hormonal levels are artificially managed. Then tubectomy, also hormonal levels are disturbed. Excessive stress, चिंता नाम चाति चिंतनात, रसवस्त्र दुष्टि का लक्षण तो है ही, एंड मनसो भी तापात भी गर्भम चिरात वंदनते ऐसा बोला है. Then withdrawal bleeding after taking the hormonal pills. Many patients nowadays visit to our clinic. They are college girls, and after 6 months or 8 months, they decide, oh, now the exams are over, we can have the periods. And only after eating the pills, they get withdrawal bleeding. Now there is a beach. There is blighting ovum, follicle size not increasing, no formation of ovarian follicles. Then twins, congenital anomalies, low AMH levels. If time permits, I will like to show one case of low AMH level. It doesn't, we have to concentrate on the quality of the follicles, not the quantity. Then we can get the results. Then chromosomal deformity detected after karyotyping. One of the doctors, Sidheswar, I think, he told that Daivam cha tatra panchamam, and it is also a very, very important factor. Then here you are knowing all of you are knowing that in Charak Chikitsa, Mithyacharena Taha Strinam Pradushtena Artavena cha Jayante Bija Doshacha Daivacha Shunutaha Puthak. Mithyacharena, that is Mithya Ahar and Mithya Vihar. So these are the different, we can elaborate this point more, but before that, I will like to present one case. This case was having 3 IUI and 2 IVF failures, and she was suggested that you cannot conceive by your own egg, so you have to go for the donor egg. And she was actually crying, and she kept all the files in front of me, and she started crying. I kept mum, and then after I asked her, what is the problem? So doctor, if I have to do the conception after donor egg, then why should I do all these things? Whether I will adopt the child. So I asked her, I counsel her not to cry, then we will see what we can do. Then after taking her history, yes, due to Ayurveda, when we take Ayurvedic case taking, our diagnosis may be different. Their diagnosis may be different. So you can see her age is 32 years. By profession, she was a bank officer. She was having stress, that is Manasobhitapat. She was married 4 years ago, and she was anxious to conceive. She was having 3 IUI and 2 IVF failure. In 29th May 2018, one ICSI was done, and that was failed. So she was suggested that you should go for the female egg donor. Then patient came to our clinic on 23rd of June 2018. It is common belief that due to Ayurveda, when you take Ayurvedic treatment, you will get delayed results. You will not get early results. But in our clinic, we get results because the proper diagnosis is there. We can get the results within 1 to 6 months. We can get the results. When she came, her investigations were suggesting that she was having thin endometrium. Her prolactin level was high. AMH was less than 0.5 on hormonal treatment before coming to Ayurveda. 7 cycles with the hormonal and ovulation monitoring was done. There was a problem in her husband also, semen analysis, low motility, and urine sugar was 4+. But in today's topic, we are going to cover only for the female infertility. So I will not go for the detail in male infertility. Then Ayurveda के हिसाब से उसका केस टेकिंग किया तो उसका LMP था 16th of June. मेंसेस कैंटी थे और 25 डेज में आते थे. क्लॉट्स, ब्लैकिश, पेन इन लोअर एब्डोमेन एंड लेस ब्लीडिंग. पृष्ठशूल था, क्वचित शिरशूल था. मल प्रवृत्ति बद्धता थी, क्वचित सरक्त. मूत्र प्रवृत्ति सदाह, बर्निंग मिक्चुरेशन, निद्रा खंडित, क्षुधा प्राकृत, अम्लपित्त, उरोदाह, वारंवार एंटासिड्स का सेवन. ये हिस्ट्री उसने ये रिवील नहीं की थी, लेकिन उसका वमन करते समय जो पहला वेग आया तो वो पूरा लाल कलर का था और विस्त्रगंधी था. तो उसने पूछा, मैडम ये रक्त है क्या? तो वो अच्छी तरह से एग्जामिन करने के बाद लगा ये रक्त नहीं है. तो उसने बोला, मैंने बोला क्या आप एंटासिड लेती थी क्या? हाँ मैडम, मुझे क्लिनिक में, मुझे तो ऑफिस में जाना था तो मैंने ऐसे मुठ पिंच ऑफ एंटासिड्स खा के मैं क्लिनिक में जाती थी, ऑफिस में जाती थी. मुझे तो काम करना ही था, बैंक में जाना था. तो उसके साथ साथ उसको बार बार कफ था, प्रतिशय था, नाड़ी कफ, पित्त प्रधान कफ थी. एंड शी वाज हैविंग द हिस्ट्री ऑफ चिकन पॉक्स एट द एज ऑफ 25 ईयर्स. मैं दातार गुरुजी की भी विद्यार्थिनी हूँ, तो उनके हिसाब से ये रक्तगत उष्णता है, तेज महाभूत की विकृति है, तो ये बहुत बढ़ गई थी. टाइफाइड था, योनिगत श्वेतस्राव था और किंचित स्तन्य प्रवर्तन था. तो यहाँ पे क्या हो गया, रस से रक्त तैयार होते हुए जो हम करते हैं रज और स्तन्य, उसका बाय प्रोडक्ट उपधातु करके तैयार होते हैं. तो पोषण स्तन्य को जाता था और रज की निर्मिति कम होती थी. तो रज का निर्मिति कम, स्कैंटी मेंसेस और स्तन्य प्रवर्तन, ऐसा उसका ये मेटाबॉलिज्म बिगड़ गया था. तो यहाँ पे आयुर्वेदिक हिसाब से उसका जो किया तो जठराग्नि मांद्य, उससे आम निर्मिति, स्त्रोतोरोधात्मक संप्राप्ति, जठराग्नि मांद्य से धात्वग्नि मांद्य, और आप सभी को मालूम है रस मल कफ और रक्त मल पित्त की विकृति वहां पे थी। चिकन पॉक्स बड़ी उम्र में हो गई थी और रक्तगत उष्णता बढ़ गई थी, ज्वरित इव थी। तो उसके हस्बैंड ने बताया उसका हाथ गर्म लगते थे, हाथ और पैर। उधर परीक्षण में यकृत प्लीहा उष्ण स्पर्शी थे। तो उसके बाद उसका चिकित्सा क्रम हमने तय किया, स्त्रोतरोध नाशनार्थ उसका वमन प्लान किया। तेज महाभूत की विकृति थी तो परिपाठादि काढ़ा दिया। रक्त प्रसादनार्थ जिंगी शारदी यानी अनंता और मंजिष्ठा चूर्ण का फांट करते हैं और वो पीने के लिए देते हैं। और गर्भाशय की धारण क्षमता बढ़ाने के लिए उत्तर बस्ती दिया। उत्तर बस्ती में 5th डे से 9th डे तक देती है। सर्वाइकल गर्भाशय का मुख विवृत रहता है, इसलिए यहाँ पे आफ्टर 5 months शी बिकम वेरी एंशियस, मैडम मेरा मेनोपॉज आने वाला है क्या, मेरे मेंसेस तो बहुत स्कैंटी हो रहे हैं। तो मैंने बोला चलो हम ओव्यूलेशन मॉनिटरिंग करके देखते हैं। तो यहाँ पे ओव्यूलेशन मॉनिटरिंग किया तो यहाँ पे प्रीमेच्योर ओवेरियन प्रीमेच्योर रप्चर ऑफ द फॉलिकल विथ थिन एंडोमेट्रियम। यहाँ पे आप देख सकते हैं उसका जो एंडोमेट्रियम का साइज है वो 5.9 mm है और जो फॉलिकल का साइज है 13 mm है। ये हो गया है 20th नवंबर का उसका रिपोर्ट है। उसके बाद उसकी LMP हो गई 28 नवंबर। सद्य गृहित गर्भ लक्षण वहां पे उसका एक 10 दिसंबर के आसपास मुझे एक फोन आया और कांटेक्ट के बाद मुझ में थोड़ा सा अंगमर्द हो गया, थोड़ा शिवरिंग हो गया और कफन इष्टिवन का तो उसकी तकलीफ थी ही। तो मैंने वो ध्यान में रखा क्योंकि ये पेशेंट की साइकोलॉजी अच्छी तरह से रखना भी बहुत जरूरी होता है। ऑन 20 दिसंबर अगेन उसका फोन आ गया, मैडम मेरा मेंसेस स्टार्ट हो गए हैं लेकिन होता ही है, कुछ ब्लीडिंग होता ही नहीं है, सिर्फ स्पॉटिंग होता है। मैंने बोला ठीक है 4 दिन वेट एंड वॉच करते हैं। मेरे हिसाब से वो प्रेगनेंसी थी तो मैंने वेट एंड वॉच करने के लिए बोला। रज प्रवर्तन के लिए कुछ भी नहीं दिया, ना ही बस्ती दिया। और 25 दिसंबर को उसका अगेन फोन आ गया तो मेंसेस हो गई नहीं और रोने लगी, मेरा मेनोपॉज हो गया। तो मैंने बोला यूपीटी कर लो। तो वो ऐसा लुक दिया कि मैडम आप मैड है क्या, तो मैंने बोला कर लो। तो यहाँ पे यूपीटी स्ट्रॉन्ग पॉजिटिव आ गई। सुबह 5 बजे उसके आयुर्वेदिक ट्रीटमेंट यहाँ पे स्टार्ट की हमने 23rd जून को। तो विद इन हमें 6 month हमें रिजल्ट मिल गए। पेशेंट कंसीव्ड। आफ्टर दैट मासानुमासी की ट्रीटमेंट अकॉर्डिंग टू हमने दे दिया। तो आप यहाँ पे देख सकते हैं। लेकिन यहाँ पे एक बात मैं आपका ध्यान बढ़ाना चाहती हूँ क्योंकि जेस्टेशनल हमेशा क्या होता है, जेस्टेशनल एज बाय सोनोग्राफी जो होता है वो कम होता है, 2 weeks बिफोर होता है क्योंकि हम काउंट करते हैं LMP से, लास्ट मेंस्ट्रुअल पीरियड से। और गर्भ की जो वृद्धि होती है वो फीटल डेवलपमेंट जो है वो फॉलिकल साइज की बात होती है। लेकिन इस पेशेंट में ये 2 weeks अहेड थी क्योंकि वो अर्ली कंसेप्शन था, ये लेट कंसेप्शन की केस नहीं थी। तो जो आयुर्वेद के हिसाब से फॉलिकल होता है तो वो फॉलिकल बहुत दिन तक जिंदा रहता है, ऐसा बोल सकते हैं, लाइव रहता है, कंसीव होने के लायक रहता है। तो यहाँ पे USG रिपोर्ट देखा, सिंगल इंटरलाइव ट्रिपल टेस्ट किया, सभी किया क्योंकि ये करते हैं। और उसके बाद ये आप देख सकते हैं ये मेल चाइल्ड है। नाउ शी इज प्लानिंग फॉर द सेकंड प्रेगनेंसी। And this is my small word of Supraja family, my job satisfaction. Thank you. Thank you. If you want to ask any question.
Thank you very much, madam. Thank you very much. Excellent presentation, very practical. All speakers have presented their expertise, experience, and practical applied Ayurveda for infertility. I am really proud of our Ayurvedic science and experts like you. Extremely grateful to all. Now I would like to request Dr. Avdesh Pandey, radiologist, modern radiologist, but he is heading Ayurvedic Integrated Medicine Department and Institute, sorry. So welcome Dr. Avdesh ji, welcome.
Thank you, sir. नमस्कार एंड मैं अब वापस जा रहा हूँ चंडीगढ़। जिंदगी वैसे भी एक यात्रा ही है सर। वो हम लेते रहते हैं। I was listening to everybody and everybody was so, it is a pleasure to listen to इतने काबिल लोग हैं ये, और स्पेशली जो प्रोफेसर साहब थे उज्जैन से, उनकी कुछ बातें बहुत ही अच्छी लगी। मैं इसमें एक दो चीजें बोलना चाहता हूं जो हम इनफर्टिलिटी की बात कर रहे हैं। इफ अ पेशेंट कम्स टू मी, हमारा होलिस्टिक व्यू इज वेरी डिफरेंट, और हमारा तरीका यह है कि बिना कोई दवा के, चाहे वो आयुर्वेदिक, ये कॉन्सेप्ट मैं इसलिए बताना चाहता हूं बिकॉज पीपल थिंक कि मेडिसिन देंगे तभी ठीक होगा। हम ये कॉन्सेप्ट ही हटाना चाहते हैं। द क्योर विल कम फ्रॉम विद इन। हम आपको ऐसी स्थिति में ला देंगे कि आपको दवा की जरूरत नहीं पड़ेगी। दूसरा, जो उज्जैन के डॉक्टर साहब हैं, उन्होंने बोला कि मैं सभी दवा, कोई मंत्र भगवान धन्वंतरी को ये करके करना चाहता हूं, तो उसमें मैं ये बोलना चाहता हूं कि इससे बड़ी बात नहीं हो सकती है, क्योंकि ब्रह्मास्त्र नहीं है जब तक अभिमंत्रित ना किया जाए। और इसका, मैं एक साइंटिफिक आदमी हूं, जब भी मैं आपको कुछ बोलूंगा, आई विल हैव साइंटिफिक प्रूफ ऑफ व्हाट एवर आई एम सेइंग। आप एक काम करें, फॉर एन एक्सपेरिमेंट, आप एक ही सोर्स से 2 ग्लास में पानी लें, एक को एक रूम में रखें, एक को दूसरे रूम में रखें। एक में कोई गायत्री मंत्र, या कोई, अगर मुस्लिम है तो कोई आयात पढ़ दें, या कोई मंत्र पढ़ दें, और या कोई प्रेयर बोल दें, या जो भी आपकी जो भी पूजा पद्धति है आप वो कर दें, और दूसरे रूम में जाके या तो फोन पे किसी से बात कर लें या गाली दे दें, और एक तीसरे आदमी को बुलाइए और बोलिए ये दोनों पानी टेस्ट करिए। वो आपको बताएगा कि जिसमें आपने मंत्र पढ़ा था वो पानी मीठा है, बाकी खारा है, दूसरा पानी खारा है। Your words change the crystalline structure of water, and water has got memory. तो आप सोचिए, अगर ये मंत्र पानी के साथ उसका क्रिस्टलाइन स्ट्रक्चर चेंज कर सकते हैं, you are 70% water, वो मंत्र आपके साथ क्या करेंगे? I leave it at that. एंड मैं ये बोलना चाहता हूं कि ये जो अभिमंत्रित करके कोई दवा देना, इससे बड़ी बात नहीं हो सकती है, और इससे बड़ी चीज नहीं हो सकती है। हम अपने पेशेंट्स को कैसे ठीक करते हैं? अगर हमारा फार्मेसी, वी डोंट हैव अ फार्मेसी इन आवर हॉस्पिटल इन चंडीगढ़। द फार्मेसी इज, द स्पेलिंग ऑफ फार्मेसी इज FARMACY। आवर किचन इज आवर फार्मेसी। एंड फॉरेन कंट्रीज में लोग खाना कहते हैं, हमारे यहाँ प्रसाद बनता है, हमारे यहाँ खाना नहीं बनता है, क्योंकि वो अभिमंत्रित खाना है। और यही मंत्र पढ़ के यही खाना कैसे हील करता है, ये देखने जैसी बातें हैं, और ये जिंदगी में अनुसरणीय है। ये दिस इज व्हाट आई वांटेड टू से। एज फार एज उज्जैन के प्रोफेसर साहब, मुझे बहुत अच्छा लगा उनकी बात सुन के। द सेकेंड इज, दवा से पेशेंट ठीक होगा। मेरी एक रिक्वेस्ट ये है फ्रॉम द आयुर्वेदिक कम्युनिटी, ये जितने भी पेशेंट आपके पास आते हैं, आपको ये कॉन्सेप्ट जरूर निकाल देना चाहिए। व्हाई? बिकॉज पैरास्टामोल वर्सेस सुदर्शन वट्टी, हम कब तक इसमें फंसे रहेंगे? इसमें हम आयुर्वेद को, आप जब कंपटीशन में आते हैं तो कंपटीशन में इक्वालिटी होता है। कहां आयुर्वेद और कहां मॉडर्न मेडिसिन? आप उसको नीचे ला रहे हैं इक्वेट करने के लिए। आयुर्वेद बहुत ऊपर है, बहुत ऊपर है। और चूंकि मैं दोनों एस्पेक्ट्स को जानता हूं, मैं इसलिए बड़ी गंभीरता से, बड़ी सेंसिटिविटी से ये बात बोल रहा हूं। आई एम वेरी सेंसिटिव व्हेन आई से दिस। तीसरा, कमिंग टू इनफर्टिलिटी, द इनफर्टिलिटी दैट वी आर टॉकिंग अबाउट, हैव वी एवर थॉट दैट वी आर द पीपल who are a hormonally challenged generation? We are hormonally challenged. If you look at the holistic view of a patient, we are hormonally challenged. और जो एक मैडम बोल रही थी, HPA axis, hypothalamus pituitary gonadal axis, HPG axis, या जो भी वो बोल रही थी, मैं इसमें एक आयाम ऐड करना चाहता हूं। आप यकीन करके चले, पिट्यूटरी इज नॉट द मास्टर ग्लैंड। I'm going to prove it very shortly because I'm doing a PhD on pineal gland. And I'm very shortly going to prove, मेरा thesis ही मतलब इस पे है कि pineal gland, अद्वैत, is the master gland. That is the master gland. अगर मैं कल अपना slides पूरा कर पाता, उसमें मैं उसको जरूर टच करता, because वो बाद में slides में था वो. Anyway, तो pineal gland से ये सारा कुछ चलता है. आप बीमार हैं या ठीक है, वो पाइनियल ग्लैंड से चलता है. जहां पर औरतें बिंदी लगाती हैं, जहां पर हम टीका लगाते हैं, दैट इज द सरफेस मार्किंग ऑफ द पाइनियल ग्लैंड. सो यू आर एक्चुअली टचिंग योर पाइनियल ग्लैंड. और संडे को हम एक कोर्स लॉन्च कर रहे हैं, साउंड हीलिंग बाय साउंड, नादा हीलिंग, शंखनाद नाद होता है. तो ये हीलिंग में मैं ये प्रूव करूंगा कि जैसे कोई ट्यूमर है, उसको हमने ट्यूनिंग फोक लगाया और 15 दिन तक लगातार लगाया, वो श्रिंक कैसे करता है वो हम आपको डेमोन्स्ट्रेट करके ये दिखाएंगे. हमारे पास तो खैर चूंकि मैं रेडियोलॉजिस्ट हूं, आई विल हैव एविडेंस ऑफ व्हाटएवर आई एम सेइंग. एनीवे, कमिंग बैक टू द टॉपिक टुडे, वी आर अ हार्मोनली चैलेंज जनरेशन. हार्मोन्स के चैलेंजेस ऐसे हैं, हमें रात को नींद नहीं आती है बिकॉज पाइनियल ग्लैंड इज नॉट वर्किंग. इसको हमने कैल्सिफाई कर दिया है क्योंकि हम जो भी बड़ी बड़ी बातें करें, हम फिर भी टूथपेस्ट से ब्रश करते हैं. और टूथपेस्ट से आप जब ब्रश करते हैं, आप थूक देते हैं बाहर, क्योंकि टूथपेस्ट में गंदगी है. एंड टूथपेस्ट को आप अंदर लेके नहीं, देयर आर अ लॉट ऑफ केमिकल्स. लेकिन आप केमिकल्स यूज ही क्यों कर रहे हैं? अगर दांत को व्हाइट करना है तो टूथपेस्ट ही एक ऑप्शन है.
इनफर्टिलिटी
मैं सर इनफर्टिलिटी पे इसलिए आ रहा हूं कि मैं आपको हार्मोनल चैलेंजेस दिखा रहा हूं. जैसे पाइनियल, आपको रात को नींद नहीं आ रही है, उसके नीचे आ जाइए थायराइड के प्रॉब्लम्स हम ठीक नहीं कर पा रहे हैं. उसके नीचे आ जाइए कैंसर ब्रेस्ट हम ठीक नहीं कर पा रहे हैं. उसके नीचे आइए डायबिटीज हम ठीक नहीं कर पा रहे हैं. ऑल दीज आर हार्मोनल इश्यूज. उसके नीचे आ जाइए हाइपरटेंशन, ये सुप्रारीनल ग्लैंड से हार्मोन्स निकल रहे हैं, हम ठीक नहीं कर पा रहे हैं. उसके नीचे आ जाइए पीसीओडी, हम ठीक नहीं कर पा रहे हैं. एंडोमेट्रियोसिस हम ठीक नहीं कर पा रहे हैं. कंसेप्शन हम ठीक नहीं कर पा रहे हैं. उसके नीचे आ जाइए प्रोस्टेट का कैंसर हम ठीक नहीं. वी आर अ हार्मोनली चैलेंज जनरेशन. जब तक हम हार्मोन्स के इनटेक बंद नहीं करेंगे, तब तक हमारी स्थितियां यही रहेंगी. दूसरा ये है कि एज फार एज पीसीओडी एंड प्रेगनेंसी इज कंसर्न्ड, अगर हम इस पे कॉन्सेंट्रेट करें कि पीसीओडी जैसे आप कोई भी चीज, पीसीओडी मींस पॉलीसिस्टिक ओवरीज. पॉलीसिस्ट को आप यूनिसिस्ट में कैसे कर सकते हैं? आपको ऊपर से प्रेशर ये देना पड़ेगा. दैट मींस देयर इज समथिंग लैकिंग. आज देखिए, आज सब कुछ हमने इतना आराम कर लिया है, हम जैसे शिटमोट में भी चेयर पे बैठते हैं. हम पहले नीचे बैठते थे ताकि वहां पर ब्लड सर्कुलेशन प्रॉपर होता था. हमने अपने जीवन में इतना आराम अपने आप को दे दिया है कि ये सब चीजें हो रही हैं. ऑस्टियोपोरोसिस फॉर एग्जांपल, ये आराम के चलते होता है. ऑस्टियोपोरोसिस इज नॉट अ कैल्शियम डेफिशिएंसी, इट इज जस्ट अ डेफिशिएंसी, इट्स अ वेट लिफ्टिंग डेफिशिएंसी. क्योंकि हम भारतीय तरीके से जीना हमने बंद कर दिया है. तो मेरा सिर्फ यही कहना है कि दीज थिंग्स आर वेरी सिंपल. अगर हम ये हार्मोनल चैलेंजेस पेशेंट का बंद कर दें, आप देखेंगे बहुत इजीली पीसीओडी विल कम बैक टू नॉर्मल. ये नॉर्मल ओवरीज विथ अ लिटिल बिट ऑफ एक्सरसाइज एट द लोअर बैक. मेरा ये बोलना था सर. इनफर्टिलिटी बहुत आराम से डील हो सकता है विदाउट मेडिकेशन. मैं एक नया आयाम दिखाना चाह रहा था जी.
एक्सीलेंट एक्सीलेंट. आप हमेशा की तरह माँ सरस्वती के पुत्र हैं और ओजस्वी वाणी में अपनी बात रखते हैं. ग्रेट. आप मॉडर्न के डॉक्टर होके आयुर्वेद को, और आयुर्वेद भी नहीं, भारतीय संस्कृति और नेचुरोपैथी के प्रिंसिपल्स को इतना अपील करते हैं, इंप्रेस करते हैं. ग्रेट ग्रेट डॉक्टर अवधि, ग्रेट. So now I would like to request Madan sir, Professor Madan sir.
Pawan ji, pranam. Pandey ji, namaskar. Pranam ji.
Namaskar.
Thank you. I have, on the chat box, I have put your words, जो आपने जो बताया कि hormonally challenged. We humans today are the most hormonally challenged ever in the history of mankind. And you have presented it so succinctly. Wonderful. Thank you. You put it so very nicely, and you have given us now, as Pavanji says, it is amazing to hear from a modern medicine person. कि आपने सही बताया कि Ayurveda is being pulled down to make it comparable to modern medicine. वो होनी नहीं चाहिए. And that is an important message. And you have presented it so wonderfully. दो चीज very, very important. Thank you for being with us. जोड़ते रहिए जी हमारे साथ, because your presence and your energy and your contributions are very important for us, and we look forward to this. Yesterday, and I just wanted to say one or two words, Pavanji. Ek Renuka ji ki presentation. Renuka ji, namaskar. Renuka ji ki presentation, the case study that Renuka ji presented was very interesting. Isme the dates you have given and the responses you have seen, Renuka ji, this is so wonderful. अब एक हमारी हर वेबिनार में एक चीज बताते हैं जी, बच्चों को कैसे सिखाएं एक चीज जो आपने किया, कि डेट डाल के बताओ भाई क्या हुआ इस दिन क्या हुआ. इसके लिए I think we need to take some guidance from Pandey ji and from other people who are running hospital systems, you know. थोड़ा सा हो सकता है, there are other people who keep easy documentation of results, so that even the simple details can be documented.
Yeah.
Pandey ji is in Chandigarh, in Bangalore, there is a FRLHT or unke Institute for Ayurveda Integrative Medicine, wahan chal raha documentation. And there are many other groups who are doing handheld device, choti cheez, where we can document. And your descriptions, if they're documented, are very, very wonderful. I also want to thank you, Renuka ji. We will be in touch, and very, very grateful that you're there, because you come from, dusri cheez I want to say, aap log Pune mein, you are not marketing Pune correctly.
Yeah.
And this is a big problem. I keep saying Pune should become the world capital of Ayurveda. Kyun? Har waqt, anytime you go to Pune, kam se kam 4,000 se 5,000 students honge aapke collegeon mein. Pune mein any one time, agar aaj jaake dekho, undergraduate, MD, MS, PhD students ki total le lo, to kam se kam 4 to 5,000 students honge. Magar nobody is doing anything about marketing Pune as the world education center for Ayurveda. अगर आप लोग नहीं करेंगे, हम तो ले जाएंगे देवभूमि इसको. अब अग्निहोत्री जी है हमारे साथ, अगर पुणे वाले नहीं करेंगे तो फिर ले जाएंगे हम उत्तराखंड. हमारे साथ आ जाएगा पांडे जी भी. So we will take everything. अगर पुणे वाले नहीं करेंगे, we will take it somewhere else. So मेरी तरफ से one request. The last thing I want to say is the holistic concept. There was a wonderful question from Shweta ji also. I think Shweta is in Mumbai. Shweta ji, thank you for your question, asking question about non-linearity. Pandey ji has touched very nicely that point with our Professor Saab from UJJAIN. And non-linearity appears in those stories. Pandey ji has touched about the issue about water and what happens to water. Water is a complex material, how it interacts with the environment, how it interacts. We haven't understood these things. But you are using it in practice every day. You're getting good results. I think collectively we must come together. Thoda sa, I'm requesting Pandey ji also, thoda sa leadership, aapki taraf se ji, thoda aur modern medicine wale. We are discussing, Chandigarh mein, we are discussing with the Postgraduate Institute of Medical Research. And there are some very, very people who are passionate about this kind of discussion. And you are now in Chandigarh. Let us come together, please. Agnihotri ji will bring all the students from Uttarakhand. We will do something here. So for me, today's presentations were very, very moving, very, very touching, and with the case studies and the responses. There are A few more people I want to thank. There is Pradeep Sharma ji in Jaipur, and his results for male infertility are so amazing, so incredible. हमारे साथ थे पिछले पवन जी, शायद you will remember Mosmi from Kerala, लहसुन के बारे में जो मौसमी जी ने जो बताया. And Mosmi ji ke paas, she has at least 10 cases now, but she doesn't talk about it. Amazing results. So a lot of people are getting these kind of results. And I want to thank Pavan ji, Agnihotri ji, Bishnupriya ji for identifying this topic today and bringing so many wonderful presenters from around the country. And I hope we can convert this. Ujjain mein shayad there is a center of excellence now. What can we do to strengthen this center of excellence? So with those few words, Pavanji, I thank you.
Thank you, sir. Thank you very much, sir.
Wonderful, wonderful
I
guidance.
would like to request now Dr. Kamini Dhimanji.
Oh, Kamini.
Kamini Dhimanji, welcome.
Namaskar.
Namaskar, namaskar, madam, namaskar. Welcome.
Kamini ji, namaskar.
नमस्कार सर, नमस्कार. मुझे बोलना है कुछ?
अरे बिल्कुल
बिल्कुल,
आप नहीं बोलेंगे तो ये प्लेटफॉर्म कैसे सुशोभित होगा?
नहीं, बहुत बहुत अच्छे थे. ऑल द प्रेजेंटेशंस वेरी नाइस एंड बहुत टू द पॉइंट प्रेजेंटेशंस किए सबने. एंड डिफरेंट केसेस वे डिस्कस्ड. एंड आई थिंक all practitioners are very senior and doing practice since long. And they are having, I think, much more experiences. Single cases they have presented.
Mm-hmm.
I was expecting more cases from all the speakers. So in future, we may have some more cases from these speakers. And I am also working on this field. And sir is telling that practitioners are having lot many cases. Same as I am also having lot many cases. And I have discussed on various platforms. But these cases were different. And I like really very good presentations in this session. Thank you.
Thank you.
Pavanji, I am taking leave now. My apologies. Number one. Agnihotri ji, my apologies. I am leaving now. ये देखो जी, 1 minute आप लोगों के साथ हिंदुस्तान में, दूसरी minute कहीं रीगा में. Pavanji, I want to congratulate you today क्योंकि we have exceeded, I shouldn't say this, but I want to share this. Ki 50, we have exceeded, we had 51 people at one time today on your platform. I congratulate you for your excellent effort. And I take leave from everybody here. I leave this platform with Pavanji in his careful. And next time we meet, I will brief you on what we are discussing in Latvia in the Baltic countries. Namaskar.
Just 1 minute, sir. Just 1 minute.
Hanji.
On 8th March, on International Women's Day, we are conducting webinar on Rajaswala Paricharya.
Achha.
Because that is very much ignored. Everybody is saying that do whatever you like in that period, which is definitely against the law of nature. So we are conducting on that. If anybody, any expert, all our gynec experts would like to have some views on that, please communicate me. So I would like to add you in that speaker. Welcome, madam. Right from Madam Kamini ji, I am requesting. Right. Thank you. On Rajaswala Paricharya, we are not talking. And these sanitary pads companies are communicating that do whatever you like in that period. That is absolutely against the law of nature. And we will be going to focus on that with your support, your guidance.
Renuka ji, we look forward to your guidance. Bishnupriya ji, we look forward to your guidance. Kamini ji, we look forward to your guidance. Agnihotri ji, my apologies. Namaskar ji, sorry to leave you people at this
Sir,
time.
if you have got 5 minutes, you please remain here.
Achha, let me see ji.
Because we are planning that our speakers have completed their work, so we may complete our webinar within time, I think, according to Dr. Pavan Sharma.
Chalo ji, I am here with you.
अग्निहोत्री जी बहुत अच्छे से conclude करते हैं sessions को.
बिल्कुल. We are always excited to hear
maybe it is my point of interest.
So now I would request Professor V.K. Agnihotri ji for
Agnihotri ji, hamare saath, I don't know if there was somebody who asked a very important question. Kya cheez hai ye non-linearity?
Right.
Non-linearity matlab is a very important question. Ki kya hai? What is non? The biological system is so complex. Jo manushya ka sharir or response. Or aap log, you understand this very nicely. Ki jo example that the connection between the mind and the body is so very nice. Pandey ji has told us about the pituitary and calcification of the pituitary, vagara. And these are elements of that non-linearity. Microbiome, ped ki jo bacteria and how it affects all these things. These are unpredictables, you know. But you still manage a theory. You have a theory of how to understand the human body. And it came through very nicely in all the presentations today. Or Bishnupriya ji ki pehle wali isme, the role of the mind and how it is important. I don't think men understand this issue. Mary Thursday, it's a sexist comment, thoda sa reverse sexism. Ki the male of the species does not understand. I think I can see Renuka ji is agreeing with me. Renuka ji, agar aap se thoda sa ek do shabd iske upar ki female ski or male ki baare mein, it's a big topic. I think we can also discuss it later on. But since you are nodding your head, it's a very interesting perspective.
In my lecture, I always say that the men who are married, they will strongly agree with me. The female will not react to the same situation in the same manner. Sometimes she will be angry, sometimes she will be suspicious, sometimes she will be anxious, sometimes she will start crying, and it is not her, it is the hormones. Due to the hormones, you are having only one hormone as a male, but females are having different kinds of hormones, but for that matter, she reacts in a different way for the different things. The emotional factor is different. Her emotional quotient is different, and it is the hormones, because many women strongly say me that nowadays PMS, otherwise premenstrual syndrome, that is they start aggression is increased. Then some women start crying, postpartum depression is there. Actually, the hormonal storm is there happening in her body, and body cannot understand, and emotionally she cannot balance all these things. And according to me, this statement is dangerous, but her body is not so designed for this kind of stress. She started working with equally, she started earning equally, but her body is not competent enough to cope up with all this kind of stress. This is my personal opinion. I don't know what is the thing. Thank you, sir.
Thank you. We will discuss. This is a very important point. It is a. I think it will come up in many more future discussions.
Yeah, sure. Thank
you. Thank you.
Thank you, sir. Now I would like to request Professor V.K. Agnihotri ji for his valuable concluding remarks.
Thank you, Dr. Pawan Sharma, sir. Our regards to all our senior dignitaries like Professor Madan Thangavelu ji, our Professor Doma ji, Professor V.P. Sharma sahab, our Ved Nadim Patankar ji, our Surendra Pradhan ji, and all new faces which joined today and having a great post. Rightly told by Dr. Madan sir that we are the part of organizers. We are always keeping our sight over the attendance. So it cost 51, and this is our achievement in that way, that the topic of today's webinar was really important. On second point, I was having a myth that our late doctors are even being BMS or so using a lot of modern medicine practice. But today's all the curtains are up with their wonderful commitment and contribution regarding all this topic pertaining to the infertility. We all know, and we are teaching for the last 30 years or so, that previously Government of India or in our country, there was a department or ministry known as Health and Family Planning. So with its pinching sense, family planning, we were all deprived of those persons who were not having the issues. While as under the heading of family planning, they were always in search of the target couples who have got 1, 2, 3 kids, and then they were advised to go for tubectomy or vasectomy. So nobody was caring for the issueless couples. So naturally, the term was changed as from family planning to family welfare. And from family welfare, this came forward that what is sterility in males and infertility in females. So that was the important point. And now it is keeping all the very, very important possible sectors. So starting with our guest speakers, Professor Bishnupriya Mohanty, with all her ability, which is always there, put forward all the etiological factors. Along with, she emphasized over the correction of Apanvayu, very naturally, which has got its seat near the Vasti place. So right from Uttar Vasti and covering all these things, the Somanasya Garbhadharana concept was also being put forward. This is one thing, if it is taken in practice, it will come with results, because all our lead doctors, they came with their personal experiences treated by them. Dr. Bishnupriya talked about a 23-year-old girl not having proper menses with a scanty menses, and ultimately she got pregnancy by her treatment. So really, I was thinking that only Madam P.V. Tiwari was doing all these things in BHU with a Ayurvedic approach. But all these things, I had an occasion being a participant in a lecture series in the memory of Madam Tiwari, and Dr. Omni was very much there. So there also all these things they put forward with their Ayurvedic knowledge. So on other speakers, I would like to refer first to Dr. our Renu. I think she is Kulkarni. Apart from Madhura Kulkarni, the other one is Renuka Mahesh Kulkarni. Really, she impressed me like anything, that it is Maharashtra or other Pune. Maharashtra is coming very forward with the Ayurvedic treatment. She wonderfully narrated her experiences. And all the way, our Dr. Avdesh Pandeji's every sentence make our total preparation with the Prakshep Davya. His every sentence ornamented with the Indian civilization, our Indian civilization, along with the Ayurvedic put and spirituality, gives an impression of Prakshep Davya Chavanprash. So that makes a thing very tasty. So our today's speakers, right from Professor Bishnupriya to Madhura Kulkarni, she did a lot of work for last 30 years, and our Renuka Mahesh Kulkarni ji, along with our Professor Saab Ujjain. Really, he touched that point, which roughly modern medicine persons avoid, and we Ayurvedic persons always keeping some spiritual impact, saying something. As they write, RX means thou take. We say we are prescribing medicine, and our Veda Dhanwantari help us to reach the positive result. Om Namah Shivaya or Om or the prayer to Dhanwantari, important. But this thing which is been put forward by all our speakers, that in males we have got Shukra Dhatu as such, full Dhatu. While as in females, when we talk about Artava, it is Upadhatu of Rakta. So very naturally approach for correction of Rasa Dhatu to Rakta Dhatu, we will be in position to have a proper menstrual cycle. For that, Deepan, Pachan, Rochak, Anloman, Vatanloman, Apanvayu, Dusti, These all were the factors which repeatedly in different speakers, where this thought was there in different speakers lecture. So this thing is very important, which has been projected by our all these expert lady doctors of Ayurveda for the students, especially when they go for their MD or PhD work. They should always see that whether they are going to work on infertility, apart from medicines, this physiological or physiopathological approach must be taken. And as Dr. Pandey told that it's not the medicine which works, or it is not necessarily necessary to be medicine to be used. It is all the holistic approach that we should see the etiological factors, and our approach may be helpful for removing the hetu, the karana. So today's webinar was completely fruitful, along with all the cultivations and their positive results in database results. So our greetings to all the great speakers, and may God bless them for their knowledge and for their practical hand. And Maharashtra should come forward, as Professor Madan Thangavelu told that it is Pune and Maharashtra where a number of students are studying because of number of private Ayurvedic colleges. So they can be given all this today's knowledge, especially for the female students, those who are tomorrow's female led doctors. So thank you all. Thank you very much. Thank you. Over to Pawan Sharma sir.
Thank you very much. बहुत ऐसी उपदेशात्मक और पूरी मार्ग निर्देशात्मक वेबिनार, मतलब आजकल तो हम देख रहे हैं कि सभी स्पीकर्स ऐसे प्रभावित करते हैं कि वो बहुत दिनों तक याद रह जाते हैं। मैं सभी का आभारी हूं। ये यात्रा चालू रहे, और कल हम इम्प्रूव ब्रेन पावर पर बात करेंगे शाम को। इम्प्रूव ब्रेन पावर, उसमें भी एक्सपर्ट्स हम लोगों को गाइड करेंगे। प्लीज जरूर जुड़िएगा। ये यात्रा अपनी है, आपकी है, हम सबकी है। ये अकेले कोई एक प्लेटफॉर्म की यात्रा नहीं है। हम जितना जुड़ेंगे और एमडी और पीएचडी स्कॉलर्स को जितना जोड़ेंगे, उतना मेरे हिसाब से सभी के लिए बेनिफिशियल है। सभी से मेरी ये प्रार्थना है, एमडी और पीएचडी स्कॉलर्स को कम से कम इसमें जोड़ा जाए, और जितनी अधिक संख्या में जोड़ा जाए उतना सभी का अच्छा होगा, ऐसा मेरा विश्वास है। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मां कश्चित् दुःखभाग् भवेत्। ये हमारा संकल्प साकार होगा। धन्यवाद सर, धन्यवाद, बहुत बहुत धन्यवाद।
नमस्कार।
प्रणाम सर।
नमस्कार।
नमस्कार सर।
Thank you, sir. Thank you so much.
थैंक यू।